Metabolic surgery is an innovative and transformative medical intervention that has emerged as a powerful tool in combating type 2 diabetes. Unlike traditional weight loss procedures, it focuses on correcting the metabolic imbalances that drive the disease. By altering the anatomy of the digestive system, metabolic surgery helps regulate blood sugar levels, improves insulin sensitivity, and, in many cases, induces remission of type 2 diabetes. This approach addresses the underlying causes of diabetes rather than merely managing its symptoms, offering hope for those struggling with obesity and poorly controlled blood sugar levels. For individuals battling type 2 diabetes, metabolic surgery can be life-changing. It goes beyond controlling blood sugar, providing significant health benefits like reducing reliance on medications, mitigating the risks of complications, and improving overall quality of life. Numerous studies have shown remarkable success in not only glycemic control but also long-term health outcomes. By focusing on the metabolic aspects of the disease, metabolic surgery shifts the paradigm from symptom management to addressing the root causes. Metabolic surgery, often used interchangeably with bariatric surgery, involves procedures designed to alter the digestive system. While bariatric surgery traditionally aims for weight loss, metabolic surgery prioritizes improving metabolic health, particularly in patients with type 2 diabetes. These surgeries modify the stomach and/or intestines, reducing food intake and influencing critical hormonal and metabolic pathways that regulate blood sugar. This distinction highlights the shift in focus from weight loss to metabolic correction, reflecting an evolution in surgical strategies. Type 2 diabetes, a chronic condition characterized by insulin resistance and high blood sugar, poses a growing global health challenge. Closely associated with obesity, sedentary lifestyles, and genetic factors, it often proves difficult to manage with lifestyle changes, medications, and insulin therapy alone. For many, these treatments fail to provide long-term relief or remission. As the prevalence of type 2 diabetes continues to rise, there is an urgent need for more effective solutions. Metabolic surgery offers a promising alternative for individuals who have struggled to control their diabetes despite optimal medical care. By targeting insulin resistance and other metabolic dysfunctions, it addresses the disease at its core. The mechanisms through which metabolic surgery improves diabetes outcomes are multifaceted. By altering the anatomy of the digestive tract, the surgery triggers hormonal changes that enhance insulin secretion and promote satiety. Hormones like GLP-1 and PYY play a pivotal role in these processes. Additionally, the resulting weight loss reduces fat mass, improving insulin sensitivity. The surgery also induces changes in the gut microbiome, positively affecting glucose metabolism, and limits nutrient absorption, which directly impacts blood sugar control. The impact of metabolic surgery on type 2 diabetes is profound. Many patients experience dramatic improvements in blood sugar levels within weeks of surgery, often before substantial weight loss occurs. This rapid improvement underscores the metabolic effects of these procedures, which extend beyond weight reduction. For some, the surgery leads to remission, where normal blood sugar levels are maintained without diabetes medication. However, remission is influenced by factors such as the duration of diabetes, preoperative insulin use, and the specific type of surgery performed. Metabolic surgery is not a universal solution, and not everyone is a suitable candidate. Candidates are carefully evaluated based on specific criteria, including body mass index, BMI, the severity of diabetes, and overall health status. While traditionally recommended for individuals with a BMI of 35 or higher, it is increasingly considered for those with a BMI between 30 and 34.9 if diabetes is poorly controlled. Patients must also be prepared, both physically and psychologically, for the lifestyle changes required after surgery. Beyond its impact on diabetes, metabolic surgery offers a host of additional benefits. It reduces cardiovascular risks, improves kidney function, and enhances mental health. For many, the surgery represents not just a treatment but a new lease on life. However, achieving successful outcomes requires a comprehensive, multidisciplinary approach. Surgeons, endocrinologists, dietitians, psychologists, and primary care providers must collaborate to support the patient throughout the journey. Preoperative education, postoperative care, and lifelong follow-up are essential components of this process. Despite its benefits, metabolic surgery is not without risks. Patients may face complications such as infection, bleeding, or nutrient deficiencies. Long-term effects, like dumping syndrome or hypoglycemia, also require careful management. Addressing concerns about safety, effectiveness, and the long-term implications of the surgery is crucial. Modern surgical techniques and advancements have significantly reduced risks, making it a safe and effective option for many eligible patients. It is important to emphasize that this information is for educational purposes only and should not be considered medical advice. Anyone considering metabolic surgery should consult a qualified healthcare provider to determine if it is the right option. Each patient's situation is unique, and decisions about surgery must be based on a thorough evaluation by a medical professional. Always seek guidance from a licensed healthcare provider for any questions about type 2 diabetes or its treatments. Metabolic surgery represents a transformative advancement in the treatment of type 2 diabetes. By addressing the root causes of the disease, it offers the potential for remission and significant improvements in overall health. However, it is not a one-size-fits-all solution and requires careful consideration, preparation, and commitment from both patients and healthcare providers. With continued research, education, and innovation, metabolic surgery holds the promise of changing the lives of millions affected by type 2 diabetes. Definition and goals. Metabolic surgery is a groundbreaking medical approach that redefines how we treat type 2 diabetes. Unlike traditional weight loss strategies or medications that primarily manage symptoms, metabolic surgery focuses on addressing the metabolic imbalances at the root of the disease. At its core, this surgical intervention seeks to restore the body's ability to process blood sugar effectively, a function severely impaired in type 2 diabetes. It represents a transformative shift in diabetes care by targeting the intricate mechanisms that contribute to insulin resistance, abnormal blood sugar levels, and the progression of diabetes. The defining feature of metabolic surgery is its unique emphasis on metabolic health rather than weight loss alone. While procedures like gastric bypass or sleeve gastrectomy were initially developed as bariatric surgeries aimed at reducing obesity, research has shown their profound impact on improving blood sugar regulation. This discovery has elevated metabolic surgery from a weight loss tool to a powerful treatment for type 2 diabetes, even in individuals who are not classified as severely obese. The surgery modifies the anatomy of the stomach and intestines, creating a cascade of changes in the body's hormonal balance, gut function, and insulin sensitivity. One of the primary goals of metabolic surgery is to improve insulin sensitivity. In type 2 diabetes, the body's cells become resistant to insulin, a hormone critical for transporting glucose from the blood into cells where it is used for energy. This resistance forces the pancreas to produce more insulin to compensate, leading to a cycle of dysfunction that can exhaust the pancreas and worsen diabetes over time. Metabolic surgery disrupts this cycle. By altering the digestive system, it enhances the body's response to insulin, allowing blood sugar levels to stabilize and reducing the need for medications or insulin injections. In addition to improving insulin sensitivity, metabolic surgery has a direct impact on hormones involved in appetite, digestion, and glucose regulation. Hormones like glucagon-like peptide 1, GLP-1, and peptide YY, PYY, play a vital role in controlling blood sugar and hunger. After metabolic surgery, the levels of these hormones increase, promoting better insulin secretion, reducing appetite, and improving satiety. This hormonal shift is one of the reasons why many patients experience rapid improvements in their diabetes, often within weeks of surgery, long before significant weight loss occurs. Another significant aspect of metabolic surgery is its effect on the gut microbiome, the community of bacteria in the digestive tract. The gut microbiome influences many aspects of health, including glucose metabolism. In people with type 2 diabetes, the composition of gut bacteria is often imbalanced. Metabolic surgery alters this microbiome, fostering a healthier environment that supports better blood sugar control. These changes are still being studied, but they are believed to play a crucial role in the surgery's effectiveness. Weight loss, though not the primary goal, remains an important benefit of metabolic surgery. Excess weight is a major contributor to insulin resistance and other metabolic issues, so reducing body fat can significantly improve diabetes outcomes. However, what sets metabolic surgery apart is its ability to achieve glycemic control independently of weight loss. This makes it a valuable option for individuals with type 2 diabetes who may not meet the traditional criteria for bariatric surgery, such as those with a body mass index, BMI, below 35 but with poorly controlled diabetes. For patients with long-standing diabetes or those struggling to achieve control despite using multiple medications, metabolic surgery offers a potential lifeline. Traditional diabetes treatments often require a lifetime of management, involving strict dietary changes, exercise routines, and medication regimens that may not fully control the disease. In contrast, metabolic surgery provides a more definitive intervention that addresses the disease's root causes. Many patients experience partial or complete remission of their diabetes, defined as achieving normal blood sugar levels without medication. While remission is not guaranteed, the surgery significantly reduces the burden of diabetes and its associated risks. The broader goals of metabolic surgery extend beyond diabetes control to encompass overall health improvement. Type 2 diabetes is a leading cause of complications like heart disease, kidney damage, nerve pain, and vision problems. By stabilizing blood sugar levels and improving metabolic function, metabolic surgery helps reduce the risk of these complications. Patients often report better energy levels, improved mobility, and a renewed sense of well-being. For some, the surgery represents a turning point in their lives, offering not just better health but the opportunity to pursue activities and goals they previously thought unattainable. It's important to understand that metabolic surgery is not a quick fix or a standalone solution. The surgery is most effective when combined with a comprehensive, multidisciplinary approach to care. Patients must commit to significant lifestyle changes, including adopting a balanced diet, engaging in regular physical activity, and attending follow-up appointments. Surgeons, endocrinologists, dietitians, psychologists, and other healthcare providers work together to guide patients through this journey. Preoperative education and postoperative care are critical to ensuring that patients achieve the best possible outcomes. Despite its benefits, metabolic surgery is not without challenges and considerations. As with any surgery, there are risks involved, including infection, blood clots, and complications related to anesthesia. However, advances in surgical techniques and perioperative care have made these procedures safer than ever before. Another common concern is the possibility of long-term nutritional deficiencies, as some surgeries limit the absorption of certain vitamins and minerals. Patients must take prescribed supplements and follow dietary guidelines to avoid these issues. Additionally, metabolic surgery is not suitable for everyone. Candidates are carefully selected based on criteria such as BMI, the severity of their diabetes, and their overall health. Those with poorly controlled type 2 diabetes despite optimal medical therapy are often the best candidates. However, the decision to undergo surgery must be individualized, taking into account each patient's unique circumstances, goals, and preferences. The psychological impact of metabolic surgery is another important consideration. For many, the surgery is a deeply emotional decision, representing hope for a healthier future but also requiring significant adjustments to daily life. Patients may experience a range of emotions, from excitement and relief to anxiety and fear. Comprehensive preoperative counseling and ongoing support are essential to help patients navigate these challenges and stay motivated. In conclusion, metabolic surgery represents a paradigm shift in the treatment of type 2 diabetes. By focusing on the metabolic dysfunctions at the heart of the disease, it offers a powerful and potentially life-changing option for those struggling to manage their diabetes. Beyond weight loss, the surgery achieves profound improvements in blood sugar control, insulin sensitivity, and overall metabolic health. It provides a pathway to remission for many and reduces the risk of diabetes-related complications for almost all who undergo it. However, it is not a universal solution and requires careful consideration, thorough preparation, and a long-term commitment to lifestyle changes. With its growing recognition and success, metabolic surgery is transforming the landscape of diabetes care and offering new hope to millions worldwide. Eligibility criteria. Metabolic surgery is a revolutionary approach to managing obesity and type 2 diabetes, and its eligibility criteria have evolved to include a broader range of patients who may benefit from this procedure. As medical research deepens, the understanding of how metabolic surgery impacts not just weight but overall metabolic function continues to expand. This procedure is now recognized as more than a weight loss solution. It is seen as a way to address the root causes of metabolic diseases, such as type 2 diabetes, insulin resistance, and other obesity-related health issues. However, determining who is eligible for metabolic surgery is an essential part of ensuring its effectiveness and safety for each patient. In this expanded discussion, we will further delve into the criteria used to determine eligibility for metabolic surgery, explaining the nuances of each qualification and the factors involved in the decision-making process. From BMI thresholds to the control of type 2 diabetes, and from obesity-related complications to the psychological readiness of patients, the eligibility criteria are designed to identify those who will gain the most benefit from this transformative procedure. Understanding BMI, the cornerstone of metabolic surgery eligibility. At the core of metabolic surgery eligibility lies body mass index, BMI, a widely used measurement that categorizes individuals based on their weight relative to their height. The BMI categories include underweight, normal weight, overweight, and various levels of obesity. Individuals with a BMI of 30 or higher are considered to be overweight or obese, and it is within this group that metabolic surgery has shown substantial benefits, particularly for those with type 2 diabetes and other obesity-related health issues. For individuals with a BMI of 40 or higher, the need for metabolic surgery is often clear. These individuals are classified as severely obese, and they face an increased risk of developing a range of serious health problems. Obesity is a leading contributor to conditions such as heart disease, stroke, high blood pressure, and, most significantly, type 2 diabetes. In these cases, traditional treatments like diet, exercise, and medication often fail to provide long-term relief, as their obesity-related metabolic dysfunction is deeply ingrained. Metabolic surgery, such as gastric bypass or sleeve gastrectomy, directly addresses this dysfunction by altering the digestive system in a way that not only aids in weight loss but also improves the body's ability to manage blood sugar levels. Obesity-related complications, the added burden of disease. While BMI is a critical factor in determining eligibility for metabolic surgery, it is not the only consideration. Obesity often brings with it a host of complications that can exacerbate health problems and complicate diabetes management. These complications can include obstructive sleep apnea, which disrupts breathing during sleep, high blood pressure, hypertension, high cholesterol, and joint problems. Moreover, severe obesity often leads to non-alcoholic fatty liver disease, gastrointestinal issues, and even certain types of cancer. Type 2 diabetes is perhaps the most significant obesity-related complication that affects individuals with a high BMI. The relationship between obesity and insulin resistance is well documented. Excess fat, particularly around the abdominal area, increases the body's resistance to insulin, making it harder to regulate blood sugar. As a result, individuals with obesity-related type 2 diabetes may find it increasingly difficult to manage their blood sugar levels, despite adhering to prescribed treatments and lifestyle changes. For these individuals, metabolic surgery offers a multifaceted solution. The procedure not only helps with weight loss but also improves insulin sensitivity, which can lead to better blood sugar control. In many cases, patients experience significant reductions in their need for medications or even achieve remission, where their blood sugar levels stabilize to normal levels without the need for ongoing diabetes treatment. For individuals with obesity-related complications, metabolic surgery can be a life-changing procedure that improves both metabolic health and overall quality of life. The expanding criteria for metabolic surgery, including BMI 30 to 35. In recent years, the criteria for metabolic surgery have expanded to include individuals with a BMI of 30 to 35, especially if they have poorly controlled type 2 diabetes. Historically, metabolic surgery was reserved for individuals with a BMI of 35 or higher, but emerging research and clinical findings have shown that patients with a lower BMI, especially those with severe and difficult-to-control diabetes, can benefit from the procedure. This change in eligibility is based on evidence showing that metabolic surgery can effectively treat type 2 diabetes by addressing the underlying metabolic dysfunction, even in individuals who are not severely obese. For people with a BMI in the 30 to 35 range, type 2 diabetes can still be a major health burden, and traditional methods of managing the disease may fall short. These patients may have already tried lifestyle modifications, such as dietary changes and regular exercise, along with the use of medications, yet their blood sugar levels remain poorly controlled. In such cases, metabolic surgery can offer a more direct and effective treatment by improving the body's ability to regulate blood sugar, independent of weight loss. In addition to controlling blood sugar, metabolic surgery in individuals with a BMI of 30 to 35 may also help reduce the need for diabetes medications, improve heart health, and alleviate other obesity-related complications. For many patients, the benefits of metabolic surgery go beyond weight loss, making it an attractive option for individuals who are struggling to manage their diabetes and overall health despite their best efforts. Type 2 diabetes and its impact on eligibility, the role of poorly controlled diabetes. When discussing the expanding eligibility for metabolic surgery, it is essential to focus on what is meant by poorly controlled type 2 diabetes. Type 2 diabetes is a chronic condition that affects how the body processes blood sugar, glucose. In the early stages, it is often manageable through lifestyle changes, including diet and exercise, along with oral medications. However, as the disease progresses, it can become harder to control, particularly if the body becomes resistant to insulin. When diabetes is poorly controlled, it means that the patient's blood sugar levels remain consistently elevated, despite following prescribed treatments. This can lead to a variety of complications, such as nerve damage, kidney disease, vision problems, and cardiovascular issues. In these cases, metabolic surgery becomes a potential solution for managing the condition more effectively. Research has shown that for individuals with poorly controlled type 2 diabetes, metabolic surgery can significantly improve insulin sensitivity, promote weight loss, and, in many cases, lead to diabetes remission. For people with a BMI between 30 and 35 who are struggling with uncontrolled diabetes, metabolic surgery can be a life-changing option. By directly addressing the body's metabolic dysfunction, the surgery helps to restore normal insulin function and improve blood sugar control. Many patients experience a reduction or complete elimination of their need for diabetes medications, and some even achieve normal blood sugar levels without the need for ongoing treatment. Comprehensive health assessment and suitability for surgery. While BMI and diabetes control are key factors in determining eligibility for metabolic surgery, they are not the only considerations. Metabolic surgery is a significant medical procedure that carries risks, and candidates must be assessed for their overall health and suitability for surgery. Healthcare providers will consider factors such as age, pre-existing medical conditions, and overall physical and mental health when making a determination. Certain individuals may not be suitable candidates for metabolic surgery if they have severe cardiovascular conditions, uncontrolled mental health disorders, or other health issues that may complicate the recovery process. Patients with a history of heart attacks, strokes, or other serious heart problems may need to undergo further testing before surgery to ensure that they can handle the changes that come with the procedure. Similarly, individuals with psychiatric conditions, such as severe depression or eating disorders, may require additional psychological support before and after the surgery to ensure they are mentally prepared for the changes in lifestyle that the procedure entails. Additionally, patients must be willing and able to commit to the long-term lifestyle changes that accompany metabolic surgery. This includes adopting new eating habits, increasing physical activity, and attending follow-up appointments to monitor their progress. The surgery is not a quick fix, but rather a tool that, when combined with long-term commitment, can lead to significant health improvements. It is crucial that patients understand this before proceeding with surgery and are willing to make the necessary changes to support their ongoing health. Psychological readiness, the mental commitment to change. Metabolic surgery is not only a physical procedure but also a psychological journey. After the surgery, patients must adjust to a new lifestyle, which includes changes in diet, exercise, and emotional well-being. These adjustments can be challenging, and individuals must be mentally prepared for the long-term commitment required to make these changes stick. Some patients may undergo psychological evaluations before surgery to assess their mental readiness and ability to handle the challenges that come with the procedure. For individuals with a history of eating disorders or other psychological issues, additional support may be necessary to ensure that they can cope with the changes in eating habits and lifestyle. It is important for patients to have realistic expectations and to understand that the surgery is only a tool to help them manage their health. It is not a magic solution. By providing psychological support and education, healthcare providers help patients navigate the emotional aspects of the surgery and ensure that they are equipped to make lasting changes that will lead to improved health outcomes. A transformative option for eligible patients. The eligibility criteria for metabolic surgery continue to evolve, reflecting a deeper understanding of how this procedure can help individuals with obesity and type 2 diabetes. By expanding the criteria to include individuals with a BMI of 30 to 35, particularly those with poorly controlled diabetes, metabolic surgery is now accessible to a wider range of patients who may benefit from its life-changing effects. As the medical community continues to study the long-term benefits of metabolic surgery, we can expect further refinement of the eligibility criteria to ensure that the right individuals receive this transformative treatment. For those who qualify, metabolic surgery offers a powerful opportunity to improve metabolic health, control type 2 diabetes, and reduce the risk of obesity-related complications. However, eligibility for the surgery is not determined by BMI alone. A comprehensive assessment that includes factors like diabetes control, overall health, and psychological readiness is essential to ensure that each patient is a good candidate for the procedure. By considering these various factors, healthcare providers can help patients make informed decisions about their treatment options and achieve lasting improvements in their health and quality of life. Types of metabolic surgeries, a detailed exploration. Metabolic surgery has become an important tool in the fight against obesity and type 2 diabetes, offering patients a way to address not just weight loss, but the underlying metabolic dysfunction associated with these conditions. Over the years, various surgical procedures have been developed to treat obesity, each with its unique approach and impact on the body. These surgeries work by altering the anatomy of the digestive system, reducing the stomach's capacity, or rerouting parts of the intestine, leading to significant weight loss and improvements in metabolic health. However, not all metabolic surgeries are the same. Each type has its advantages, risks, and benefits, making it important to understand the differences when considering which option may be best for a patient's individual needs. In this expanded discussion, we will delve into the four primary types of metabolic surgeries: Roux-en-Y gastric bypass, RYGB, sleeve gastrectomy, duodenal switch, and adjustable gastric banding. We will explore how each surgery works, what it involves, and the impact it can have on a patient's weight loss and overall health. From the way the surgeries alter the digestive process to the potential side effects, we will examine these procedures in depth to help provide a comprehensive understanding of how they can help patients achieve lasting health improvements. Revolutionized gastric bypass, RYGB, a comprehensive approach to weight loss and metabolic health. Revolutionized gastric bypass, RYGB, is one of the most commonly performed metabolic surgeries and has been in practice for decades. It is often recommended for patients who have severe obesity, a BMI of 40 or higher, or obesity-related health complications, such as type 2 diabetes. This surgery involves both restrictive and malabsorptive components, making it highly effective for weight loss and metabolic improvements. The procedure begins by creating a small pouch at the top of the stomach, which significantly reduces its size. This pouch, about the size of an egg, limits the amount of food a person can consume at one time. Next, the small intestine is rerouted to connect to this small stomach pouch, bypassing the larger part of the stomach and the initial portion of the small intestine, the duodenum. This alteration in anatomy serves two important functions. It limits the number of calories a person can consume, due to the smaller stomach, and it changes the way nutrients are absorbed by bypassing part of the small intestine, reducing the amount of calories and nutrients that are absorbed into the body. The effects of RYGB on weight loss are significant, with many patients losing 60% to 80% of their excess weight within the first 12 to 18 months after surgery. In addition to weight loss, RYGB has proven to be highly effective in improving metabolic health, particularly for individuals with type 2 diabetes. Many patients experience a reduction or even remission of diabetes, as the surgery helps to improve insulin sensitivity and regulate blood sugar levels. This has made RYGB a popular option for patients with obesity and poorly controlled diabetes, as it offers the potential for both weight loss and improved metabolic function. However, like any surgical procedure, RYGB comes with its risks and potential complications. The bypassed section of the small intestine can result in nutrient malabsorption, which may lead to deficiencies in vitamins and minerals, particularly vitamin B12, iron, calcium, and vitamin D. As a result, patients must commit to lifelong nutritional supplements and regular monitoring of their nutrient levels to avoid deficiencies. Additionally, RYGB carries the risk of other complications, such as leaks, infections, and the development of ulcers in the remaining stomach pouch. Despite these risks, RYGB remains the gold standard in metabolic surgery for its proven effectiveness in achieving significant weight loss and improving metabolic conditions like diabetes. Sleeve gastrectomy, a simpler approach with significant benefits. Sleeve gastrectomy is another popular metabolic surgery that has gained widespread acceptance in recent years. It is considered less complex than RYGB, but still offers substantial benefits in terms of weight loss and metabolic health. This procedure involves the removal of a large portion of the stomach, leaving behind a small, tube-like structure, or sleeve, that resembles the shape of a banana. The new stomach is about 15% of its original size, drastically reducing the amount of food a person can consume in one sitting. Unlike RYGB, sleeve gastrectomy does not involve rerouting the small intestine, which means it is a purely restrictive procedure. It limits food intake by reducing the stomach's capacity, making it physically difficult for the patient to eat large portions. As a result, most patients experience significant weight loss, often losing 50% to 70% of their excess weight within the first year or two after surgery. The benefits of sleeve gastrectomy extend beyond weight loss. Research has shown that the procedure also leads to improvements in metabolic health, particularly for individuals with type 2 diabetes. This is largely due to the removal of a portion of the stomach that produces ghrelin, the hormone responsible for hunger. By reducing ghrelin levels, sleeve gastrectomy helps to control appetite and may contribute to better blood sugar control in patients with diabetes. Many patients find that they are able to reduce or eliminate their need for diabetes medications after undergoing this surgery, as their blood sugar levels stabilize and insulin sensitivity improves. Another advantage of sleeve gastrectomy is that it does not require foreign devices, such as gastric bands or bypassed intestines, making it a simpler procedure with a lower risk of complications compared to RYGB. While the surgery is generally safe, patients may still experience side effects, including acid reflux, nausea, and difficulty with consuming certain foods. Additionally, there is still a risk of nutritional deficiencies, particularly in vitamin B12 and iron, though this is generally less common than with RYGB. Patients who undergo sleeve gastrectomy must also commit to lifelong follow-up care, including nutritional counseling and regular health monitoring, to ensure that they are meeting their nutritional needs. Duodenal switch, a more complex surgery with maximum weight loss potential. Duodenal switch is a more complex metabolic surgery that combines two procedures, a sleeve gastrectomy and an intestinal bypass. This approach aims to provide the most significant weight loss and metabolic effects by combining the restrictive component of a sleeve gastrectomy with the malabsorptive component of an intestinal bypass. The first step in the duodenal switch procedure is similar to sleeve gastrectomy, where a large portion of the stomach is removed, leaving behind a small sleeve. Next, a portion of the small intestine is bypassed, which reduces the body's ability to absorb calories and nutrients. The intestines are rerouted so that food bypasses much of the small intestine, leading to malabsorption and further weight loss. By reducing both the amount of food a person can eat and the amount of calories that are absorbed, duodenal switch maximizes weight loss and metabolic improvements. Duodenal switch is known for its significant weight loss potential, with many patients losing up to 80% or more of their excess weight within the first 18 months after surgery. In addition to dramatic weight loss, duodenal switch has been shown to be highly effective in treating type 2 diabetes. The combined effects of restricting food intake and altering nutrient absorption lead to improvements in insulin sensitivity, often resulting in a reduction or elimination of diabetes symptoms. Many patients who undergo duodenal switch experience a dramatic improvement in their overall metabolic health, with some even achieving full remission of diabetes. However, duodenal switch is a more complex surgery with higher risks than other procedures. The bypassed portion of the small intestine can lead to significant malabsorption, increasing the risk of nutritional deficiencies, particularly in fat-soluble vitamins, A, D, E, and K, and other essential nutrients. Patients who undergo duodenal switch must take extensive nutritional supplements for life and undergo regular follow-up appointments to monitor their nutrient levels. Additionally, the surgery carries a higher risk of complications, such as bowel obstruction, diarrhea, and intestinal blockages. Despite these risks, duodenal switch is an excellent option for patients who require maximum weight loss and metabolic improvement. Adjustable gastric banding, a less common option with limited metabolic effects. Adjustable gastric banding, AGB, was once a popular choice for metabolic surgery, but its use has declined in recent years due to its limited metabolic effects and the advent of more effective procedures like RYGB and sleeve gastrectomy. The surgery involves placing a band around the upper part of the stomach, creating a small pouch that restricts the amount of food a person can eat. The band is adjustable, meaning it can be tightened or loosened to control the size of the stomach pouch. While the procedure is less invasive than other forms of metabolic surgery and does not involve removing or rerouting any parts of the digestive system, its weight loss potential is generally lower than that of other surgeries. Patients typically lose about 40% to 50% of their excess weight within the first few years after surgery. Furthermore, gastric banding has been associated with a higher rate of complications, such as band slippage, erosion, and difficulty swallowing. These issues can require additional surgeries or adjustments, making gastric banding less appealing for many patients. Additionally, gastric banding has limited metabolic effects compared to other procedures like RYGB or sleeve gastrectomy. While it can help with weight loss, it does not offer the same level of improvement in insulin sensitivity or diabetes remission. For these reasons, adjustable gastric banding is now less commonly recommended for patients with obesity and type 2 diabetes. However, it may still be a viable option for some individuals who are looking for a less invasive procedure or who are not suitable candidates for more complex surgeries. Choosing the right type of metabolic surgery. Each type of metabolic surgery offers distinct advantages, and the best option for a patient depends on a variety of factors, including their BMI, overall health, and personal preferences. Roux-en-Y gastric bypass, RYGB, is ideal for individuals who need significant weight loss and improvements in metabolic health, including type 2 diabetes. Sleeve gastrectomy offers a simpler approach with fewer complications, while duodenal switch provides the maximum weight loss potential for patients with severe obesity and metabolic conditions. Adjustable gastric banding, though still an option for some patients, is less commonly used due to its lower metabolic effects and potential for complications. Ultimately, the choice of metabolic surgery should be made in consultation with a healthcare professional, who can help guide patients through the decision-making process based on their individual needs and goals. With proper care and commitment, metabolic surgery can offer a transformative solution to obesity and related metabolic disorders, improving both quality of life and long-term health outcomes. Mechanisms of action in metabolic surgery, understanding how it works. Metabolic surgery has become a groundbreaking approach to treating obesity and type 2 diabetes. Beyond just helping patients lose weight, these surgeries target several underlying factors that contribute to obesity and metabolic dysfunction, such as insulin resistance, hormonal imbalances, and nutrient absorption issues. By altering the digestive system in specific ways, metabolic surgery doesn't just shrink the stomach, it also affects several important metabolic processes that lead to improved overall health. In this section, we will delve into the core mechanisms by which metabolic surgeries, such as Roux-en-Y gastric bypass, RYGB, sleeve gastrectomy, duodenal switch, and adjustable gastric banding, work to bring about weight loss and improved metabolic health. We will focus on 4 key mechanisms of action: weight loss and its effect on insulin resistance, hormonal changes that enhance insulin sensitivity, modification of the gut microbiome, and reduced nutrient absorption. Each of these processes plays a vital role in achieving the success of metabolic surgery, and understanding them can shed light on why this type of surgery has such a profound impact on patients' health. Weight loss and its effect on insulin resistance. One of the primary goals of metabolic surgery is to induce significant weight loss, and this weight loss plays a critical role in improving many aspects of metabolic health, especially insulin resistance. Insulin resistance occurs when the body's cells become less responsive to insulin, a hormone that helps regulate blood sugar levels. Over time, insulin resistance leads to higher blood glucose levels and can result in the development of type 2 diabetes. Obesity, especially excess fat accumulation around the abdomen, is one of the main risk factors for insulin resistance. When metabolic surgery is performed, the first immediate result is a drastic reduction in body fat, which directly impacts insulin resistance. As fat mass decreases, the body becomes more sensitive to insulin, meaning that the cells are better able to respond to the hormone signals. This effect is particularly noticeable in the liver and muscles, where insulin resistance is most problematic. By reducing fat mass, especially visceral fat, the fat stored around internal organs, metabolic surgery helps to restore the body's natural ability to regulate blood sugar levels. As a result, many patients who previously had type 2 diabetes experience a significant improvement in their blood glucose control, and some even achieve complete remission of the condition. In fact, studies have shown that weight loss following metabolic surgery leads to marked improvements in insulin sensitivity. This effect is often seen within days or weeks of surgery, even before significant weight loss has occurred. This phenomenon suggests that metabolic changes triggered by surgery, such as alterations in gut hormones and the microbiome, contribute to the improvement in insulin sensitivity, in addition to the mechanical effect of weight loss itself. The rapid improvement in insulin sensitivity after surgery is one of the key reasons why metabolic surgery is so effective for patients with obesity and type 2 diabetes. Even if patients do not lose a large amount of weight, improvements in insulin sensitivity can lead to better control over blood glucose levels and a reduction in the need for diabetes medications. Hormonal changes, enhancing insulin sensitivity and glucose regulation. Another major mechanism of action in metabolic surgery is the alteration of gut hormones that regulate appetite, insulin sensitivity, and glucose metabolism. The gut is home to a range of hormones that play a role in controlling hunger and glucose metabolism. Two of the most important hormones in this process are GLP-1, glucagon-like peptide 1, and GIP, gastric inhibitory peptide. Both of these hormones are involved in regulating insulin secretion, glucose control, and satiety, and their levels are significantly impacted by the changes made during metabolic surgery. GLP-1 is an incretin hormone, meaning it is released by the gut in response to food intake. It helps to stimulate insulin release from the pancreas, improve insulin sensitivity, and promote feelings of fullness after eating. In individuals with type 2 diabetes, GLP-1 levels are often insufficient, which contributes to poor blood glucose control. Metabolic surgery, especially Roux-en-Y gastric bypass and sleeve gastrectomy, has been shown to significantly increase GLP-1 levels. This increase in GLP-1 helps to improve insulin secretion, reduce blood sugar levels, and increase satiety, making it easier for patients to manage their weight and diabetes. Elevated GLP-1 levels also reduce appetite, which helps to prevent overeating and promote sustainable weight loss. GIP, another incretin hormone, works in a similar manner, stimulating insulin release in response to food. However, in people with obesity and type 2 diabetes, GIP may not function as effectively, contributing to impaired insulin secretion and glucose metabolism. Interestingly, studies have shown that while GIP's effects may be diminished in individuals with insulin resistance, metabolic surgery can improve its function. In fact, after surgery, GIP levels increase, and the hormone's ability to enhance insulin secretion becomes more effective. This improvement in GIP function further helps to regulate blood sugar levels and enhances the overall metabolic response. In addition to GLP-1 and GIP, metabolic surgery also affects other hormones involved in hunger and satiety, such as ghrelin and peptide YY, PYY. Ghrelin, often referred to as the hunger hormone, is produced in the stomach and signals the brain when the body is hungry. After metabolic surgery, particularly sleeve gastrectomy, the production of ghrelin is reduced, leading to decreased hunger and a greater sense of fullness. This hormonal shift helps patients consume less food, contributing to weight loss and more manageable calorie intake. Conversely, PYY, a hormone that increases feelings of satiety, is often elevated following metabolic surgery, further promoting a reduction in appetite and food intake. Together, these hormonal changes significantly enhance insulin sensitivity and glucose regulation, providing patients with better control over their blood sugar levels. This is why many patients with type 2 diabetes experience rapid improvements in their condition following metabolic surgery, even before substantial weight loss occurs. Microbiome changes, the role of gut bacteria in metabolic health. An often overlooked but crucial mechanism of action in metabolic surgery is the modification of the gut microbiome. The microbiome refers to the community of trillions of microorganisms, bacteria, viruses, fungi, and other microbes, that live in the gut. These microbes play an essential role in digestion, immunity, and metabolic processes. In individuals with obesity and metabolic dysfunction, the composition of the gut microbiome is often imbalanced, with an overgrowth of harmful bacteria and a decrease in beneficial bacteria. This imbalance has been linked to insulin resistance, inflammation, and poor metabolic health. Metabolic surgery appears to have a profound effect on the gut microbiome, leading to changes that support better metabolic health. After surgery, the composition of gut bacteria shifts, with an increase in beneficial bacteria that help improve digestion and reduce inflammation. These changes in the microbiome contribute to the improvement in insulin sensitivity and glucose regulation that many patients experience after surgery. Studies have shown that patients who undergo Roux-en-Y gastric bypass and other metabolic surgeries experience significant changes in the diversity and abundance of gut bacteria. These changes are thought to be influenced by several factors, including the alteration of the digestive tract, changes in diet, and the impact of hormonal changes following surgery. As the gut bacteria become more balanced, patients experience improvements in insulin sensitivity, reduced inflammation, and better overall metabolic function. The gut microbiome also plays a role in weight loss after surgery. Certain types of bacteria are known to help break down and absorb nutrients more efficiently, while others promote fat storage. By modifying the microbiome, metabolic surgery may help to favor bacteria that promote lean body mass and discourage the growth of bacteria that contribute to fat accumulation. As a result, the body becomes more efficient at burning fat and less prone to storing excess calories, which contributes to weight loss. The relationship between the microbiome and metabolic health is still an area of active research, but the evidence suggests that the changes in gut bacteria induced by metabolic surgery play a key role in improving insulin sensitivity and promoting weight loss. As our understanding of the microbiome grows, it may offer new opportunities for treating obesity and type 2 diabetes through dietary interventions or microbiome-based therapies. Reduced nutrient absorption, impact on glucose and fat metabolism. One of the key features of several metabolic surgeries, such as Roux-en-Y gastric bypass and duodenal switch, is the reduction in nutrient absorption. During these procedures, parts of the small intestine are bypassed, which means that food is not fully digested and absorbed as it would be in a normal digestive system. This reduction in nutrient absorption contributes to weight loss and metabolic improvements by limiting the amount of calories, glucose, and fat that are absorbed into the body. After surgery, the food bypasses a significant portion of the small intestine, reducing the number of calories and nutrients that are absorbed from digested food. This results in a lower overall calorie intake, even though patients may continue to eat the same amount of food. The reduced absorption of glucose from digested food helps to lower blood sugar levels and improve insulin sensitivity, which is particularly beneficial for patients with type 2 diabetes. By decreasing the glucose influx into the bloodstream, metabolic surgery helps to prevent blood sugar spikes and promote better blood glucose control. While reduced nutrient absorption is an important factor in weight loss, it also has implications for long-term health. Patients who undergo surgeries that bypass parts of the intestine must be vigilant about their nutritional intake, as they may be at risk for deficiencies in vitamins, minerals, and other essential nutrients. For example, vitamin B12, calcium, iron, and vitamin D deficiencies are common after surgeries like Roux-en-Y gastric bypass, and patients must take lifelong supplements and undergo regular monitoring to ensure they are meeting their nutritional needs. Despite these challenges, the overall impact of reduced nutrient absorption on weight loss and metabolic improvements makes it an important part of the mechanism of action in metabolic surgery. The comprehensive mechanisms behind metabolic surgery. Metabolic surgery works through multiple mechanisms to help patients achieve lasting weight loss and improved metabolic health. By reducing fat mass, altering gut hormones, modifying the gut microbiome, and limiting nutrient absorption, these surgeries address the root causes of obesity and type 2 diabetes. Weight loss alone is a key driver of improved insulin sensitivity, but hormonal changes, such as increased GLP-1 and GIP levels, further enhance insulin regulation and glucose control. Additionally, the modification of the gut microbiome and the reduced absorption of nutrients work synergistically to improve metabolic processes, promoting long-term health benefits. Understanding these mechanisms helps to explain why metabolic surgery is so effective in treating not just obesity but also the metabolic disorders that accompany it. As research continues to explore the exact pathways by which these changes occur, it will only deepen our understanding of how metabolic surgery can offer a transformative solution for individuals struggling with obesity and its related health complications. Impact on blood sugar levels after metabolic surgery. One of the most profound and immediate effects that many patients experience following metabolic surgery, such as Roux-en-Y gastric bypass, RYGB, sleeve gastrectomy, or duodenal switch, is a significant improvement in blood sugar levels. For individuals with obesity, especially those with type 2 diabetes, achieving normal blood sugar levels is often a long and challenging journey. Traditional methods such as medications, diet modifications, and exercise can take time to show results, and many individuals struggle to maintain consistent blood glucose control. However, in the case of metabolic surgery, many patients see their blood sugar levels begin to normalize within days or even weeks of the procedure, sometimes even before they begin to lose substantial amounts of weight. This rapid improvement in blood glucose control has made metabolic surgery a key treatment option for people with obesity and type 2 diabetes, offering hope for better health outcomes and a significant reduction in the risk of long-term complications associated with diabetes. Immediate post-surgery blood sugar improvements. After undergoing metabolic surgery, it's common for patients to experience a noticeable reduction in their blood sugar levels within the first few days to weeks post-surgery. This improvement can be so rapid that it often surprises both patients and healthcare providers. In some cases, patients may even find that their need for diabetes medications, such as insulin or oral hypoglycemics, decreases shortly after the procedure. This initial improvement in blood sugar control occurs even before patients have lost significant amounts of weight, which challenges the traditional understanding that weight loss is the primary driver of better blood sugar regulation. The reason for these early improvements lies in the complex and multifaceted effects that metabolic surgery has on the body. While weight loss is certainly a key component, other factors come into play, such as changes in gut hormones, alterations in the digestive process, and modifications to the gut microbiome. These changes contribute to a more rapid improvement in insulin sensitivity, glucose metabolism, and blood sugar regulation, providing a level of control that many patients had not experienced before. How weight loss impacts blood sugar control. While metabolic surgery often leads to immediate improvements in blood sugar regulation, long-term control is still heavily influenced by the weight loss that follows the procedure. Obesity, especially abdominal obesity, is strongly associated with insulin resistance, which is a condition in which the body's cells are less responsive to the action of insulin. This leads to higher blood sugar levels as the pancreas attempts to compensate by producing more insulin. As a result, individuals with obesity often have to manage not only high blood sugar but also high levels of insulin, which can lead to a condition known as hyperinsulinemia. After metabolic surgery, the primary goal is weight loss, and this is typically achieved within the first few months. As patients lose weight, particularly abdominal fat, they often experience significant improvements in insulin sensitivity. Insulin sensitivity refers to how effectively the body responds to insulin, and improving it is crucial for controlling blood sugar levels. As fat mass decreases, the body becomes more efficient at utilizing insulin, which helps to lower blood sugar levels and reduce the burden on the pancreas. In addition to the reduction in insulin resistance, patients may also experience a decrease in the amount of fat circulating in the bloodstream. This reduction in circulating fat, known as free fatty acids, further improves the body's ability to respond to insulin. These factors combined can lead to dramatic improvements in blood sugar levels, which often become evident in the weeks and months following surgery. Gut hormones, key players in blood sugar regulation. One of the most important and unique mechanisms through which metabolic surgery affects blood sugar levels is by altering the secretion of gut hormones. The gastrointestinal tract plays a central role in regulating metabolism through the release of various hormones that influence insulin secretion, glucose control, and appetite regulation. Two of the most important hormones involved in blood sugar regulation are glucagon-like peptide, 1, GLP-1, and gastric inhibitory peptide, GIP. Both of these hormones are released in response to food intake and are instrumental in the body's ability to control blood sugar levels. In patients with type 2 diabetes and obesity, the secretion and function of GLP-1 and GIP are often impaired. However, after metabolic surgery, particularly Roux-en-Y gastric bypass, RYGB, and sleeve gastrectomy, there is a significant increase in the production and activity of these hormones. GLP-1, for instance, stimulates insulin secretion from the pancreas and improves insulin sensitivity in the liver and muscles. It also reduces glucagon secretion, which prevents the liver from releasing too much glucose into the bloodstream. The increase in GLP-1 after surgery has been directly linked to improved blood sugar levels, often resulting in patients achieving better glucose control within days of their procedure. Similarly, GIP is another hormone that contributes to insulin secretion and glucose control. While GIP's effects are somewhat diminished in patients with obesity and diabetes, metabolic surgery has been shown to enhance its function. After surgery, GIP levels increase, and the hormone's ability to promote insulin release becomes more effective. This improvement in GIP function further helps regulate blood sugar levels and contribute to more stable glucose metabolism. These hormonal changes, particularly the increase in GLP-1 and GIP, play a key role in the early and lasting improvements in blood sugar control that many patients experience following metabolic surgery. Even before significant weight loss occurs, these hormonal shifts are already helping to improve insulin sensitivity and regulate blood glucose levels. Gut microbiome, a hidden player in blood sugar control. The gut microbiome, a collection of trillions of bacteria and other microorganisms living in the digestive tract, is another important factor that influences blood sugar regulation. In recent years, research has uncovered the significant role that the gut microbiome plays in metabolic health, including insulin sensitivity and blood sugar control. An imbalance in the gut microbiome, known as dysbiosis, has been linked to obesity, insulin resistance, and type 2 diabetes. Metabolic surgery has been shown to have a profound impact on the gut microbiome. After surgery, the composition of gut bacteria undergoes a dramatic shift, with an increase in beneficial bacteria and a decrease in harmful bacteria. These changes in the microbiome contribute to improved glucose metabolism and insulin sensitivity, which can lead to more stable blood sugar levels. Studies have found that the gut microbiome of patients who undergo surgeries like Roux-en-Y gastric bypass and sleeve gastrectomy becomes more diverse and balanced, which supports better overall metabolic function. The mechanisms by which the microbiome influences blood sugar regulation are still being studied, but it is believed that changes in the microbiome can help improve glucose metabolism through several pathways. For example, beneficial gut bacteria produce short-chain fatty acids, SCFAs, that have anti-inflammatory effects and can enhance insulin sensitivity. Additionally, the gut bacteria influence the production of gut hormones like GLP-1, which further improves insulin secretion and glucose control. As the microbiome shifts in response to surgery, these positive changes contribute to better blood sugar regulation, further improving metabolic health in patients. Reduced nutrient absorption and its impact on blood sugar levels. Another key mechanism by which metabolic surgery affects blood sugar levels is through the alteration of nutrient absorption in the digestive tract. Many metabolic surgeries, particularly Roux-en-Y gastric bypass and duodenal switch, involve rerouting parts of the small intestine, which limits the amount of nutrients that are absorbed from food. This reduced nutrient absorption has a direct impact on blood glucose levels, as less glucose from digested food enters the bloodstream. While this reduction in nutrient absorption contributes to weight loss, it also plays an important role in regulating blood sugar levels. By limiting the amount of glucose that is absorbed into the bloodstream, metabolic surgery helps prevent post-meal blood sugar spikes and reduces the overall glucose load on the body. This helps to lower blood sugar levels and improve insulin sensitivity, further aiding in the management of type 2 diabetes. Additionally, reduced nutrient absorption also impacts the absorption of fats and proteins, which can further improve metabolic health. As less fat is absorbed from the diet, patients may experience improvements in blood lipid profiles, including reduced levels of triglycerides and cholesterol, which are often elevated in individuals with obesity and diabetes. These improvements in both blood sugar and lipid levels contribute to the overall metabolic benefits of surgery. Long-term blood sugar control, sustainability of the benefits. While many patients experience rapid improvements in blood sugar levels immediately following metabolic surgery, the long-term effects are also highly significant. In the months and years following surgery, patients who maintain their weight loss and follow a healthy lifestyle often continue to enjoy stable blood glucose levels, reducing their reliance on diabetes medications and minimizing the risk of long-term complications. One of the key factors in achieving long-term blood sugar control is the sustained improvement in insulin sensitivity. As patients lose weight and continue to benefit from hormonal changes, gut microbiome modifications, and reduced nutrient absorption, their ability to manage blood sugar improves. In many cases, individuals who once struggled to control their diabetes with medications alone are able to maintain normal blood sugar levels through lifestyle changes, including diet and exercise, along with the lasting effects of their surgery. For some patients, blood sugar levels may even return to normal levels, and they may no longer meet the criteria for a diabetes diagnosis. While this doesn't mean that diabetes is cured, it does indicate a significant improvement in the management of the condition. For many patients, the improvement in blood sugar control is one of the most rewarding outcomes of metabolic surgery, offering a better quality of life and a reduced risk of complications such as cardiovascular disease, kidney damage, and nerve damage. Conclusion: a revolutionary change in blood sugar management. Metabolic surgery offers a transformative approach to managing blood sugar levels in individuals with obesity and type 2 diabetes. Through a combination of weight loss, hormonal changes, modifications to the gut microbiome, and reduced nutrient absorption, metabolic surgery provides rapid and lasting improvements in blood glucose control. For many patients, these improvements occur even before significant weight loss is achieved, which highlights the complex mechanisms at play. By improving insulin sensitivity and enhancing glucose metabolism, metabolic surgery offers a powerful tool for managing and, in some cases, reversing the effects of type 2 diabetes. As more individuals with obesity and diabetes choose surgery as a treatment option, the potential for improved health outcomes continues to grow, providing new hope for better blood sugar control and overall metabolic health. Improved insulin sensitivity after metabolic surgery, a key to better glycemic control. One of the most significant and beneficial changes that occurs after metabolic surgery is the improvement in insulin sensitivity. Insulin sensitivity refers to how effectively the body's cells respond to insulin, a hormone produced by the pancreas that helps regulate blood sugar levels. In individuals with obesity and type 2 diabetes, insulin sensitivity is often impaired, which means that the body's cells become less responsive to insulin. This leads to higher blood sugar levels, as the body needs to produce more insulin to compensate for this reduced effectiveness. Over time, this can lead to insulin resistance, where the pancreas produces increasingly more insulin to try and maintain normal blood sugar levels. However, even as the pancreas works harder, blood sugar levels can remain elevated, contributing to the progression of type 2 diabetes. Metabolic surgery, such as Roux-en-Y gastric bypass, RYGB, sleeve gastrectomy, or duodenal switch, has shown to dramatically improve insulin sensitivity, which is a critical factor in achieving better glycemic control. The mechanisms that drive this improvement are complex and multifaceted, involving changes in body composition, hormonal regulation, and alterations in metabolic processes. These changes result in the body's cells, particularly those in the liver and muscles, becoming more sensitive to insulin, helping to regulate blood sugar levels more effectively. This improvement in insulin sensitivity not only helps control blood glucose but also contributes to overall metabolic health, reducing the risks of complications associated with obesity and diabetes. The role of insulin sensitivity in glycemic control. Before diving into the impact of metabolic surgery on insulin sensitivity, it's important to understand why insulin sensitivity is so crucial for managing blood sugar levels. When we eat, food is broken down into glucose, which is absorbed into the bloodstream. In response, the pancreas releases insulin, which helps the body's cells take in glucose from the blood for energy or storage. In individuals with good insulin sensitivity, the body's cells efficiently absorb glucose, and blood sugar levels remain stable. However, when insulin sensitivity decreases, the cells become less responsive to insulin. As a result, glucose remains in the bloodstream, leading to elevated blood sugar levels. To compensate, the pancreas releases more insulin, but over time, this can lead to a state called insulin resistance, where even higher levels of insulin are required to achieve the same effect. The body struggles to maintain normal blood glucose levels, and individuals with insulin resistance often experience high blood sugar, which can lead to type 2 diabetes if not managed effectively. Improving insulin sensitivity is key to reversing insulin resistance and achieving better blood sugar control. Metabolic surgery has been shown to have a profound impact on insulin sensitivity, providing a pathway for better glycemic control, even before significant weight loss occurs. This makes metabolic surgery a promising option for individuals with type 2 diabetes and obesity who have struggled with traditional treatments. How metabolic surgery improves insulin sensitivity. Metabolic surgery improves insulin sensitivity through several mechanisms that affect the body's metabolic processes. These mechanisms are not entirely understood but have been extensively studied in clinical research. The most significant factors contributing to improved insulin sensitivity after metabolic surgery include changes in body composition, gut hormone alterations, and modifications to the gut microbiome. Let's explore these factors in more detail. 1. Reduction in fat mass. One of the primary mechanisms through which metabolic surgery improves insulin sensitivity is through the reduction of fat mass, particularly visceral fat. Visceral fat, which is the fat stored around internal organs such as the liver and intestines, is closely associated with insulin resistance. This type of fat releases free fatty acids into the bloodstream, which can interfere with insulin signaling and reduce the effectiveness of insulin in muscle and liver cells. As fat cells shrink following metabolic surgery, the production of free fatty acids decreases, leading to improved insulin sensitivity. In addition to the reduction in visceral fat, weight loss following surgery also leads to an overall reduction in total body fat. This helps to lower the body's overall insulin resistance, improving the efficiency of insulin in regulating blood glucose. The greater the weight loss, the more insulin sensitivity tends to improve, which is why patients who undergo metabolic surgery often experience significant reductions in blood sugar levels. 2. Hormonal changes, the role of gut hormones. Another critical factor in the improvement of insulin sensitivity after metabolic surgery is the alteration of gut hormones. The gastrointestinal tract plays a crucial role in regulating metabolism by secreting hormones that influence insulin release, glucose regulation, and appetite control. Two key hormones, glucagon-like peptide 1, GLP-1, and gastric inhibitory peptide, GIP, are particularly important in regulating insulin sensitivity in glucose control. Before metabolic surgery, patients with obesity and type 2 diabetes often have impaired secretion of these hormones. However, after surgery, the production and activity of GLP-1 and GIP increase significantly. GLP-1, for instance, helps to increase insulin secretion from the pancreas when blood sugar levels rise, and it also enhances insulin sensitivity in the liver and muscles. This means that after surgery, the body becomes more effective at utilizing insulin to regulate blood glucose, leading to better control of blood sugar levels. Similarly, GIP is another hormone that plays a role in insulin release. After surgery, the function of GIP is improved, which further enhances insulin secretion and sensitivity. The increased secretion of GLP-1 and GIP following surgery helps to regulate blood sugar levels and improves insulin sensitivity in the liver and muscles, contributing to better overall glycemic control. 3. Modifications in the gut microbiome. Recent research has also highlighted the role of the gut microbiome in metabolic health. The gut microbiome refers to the trillions of bacteria and microorganisms living in the digestive system, and an imbalance in the microbiome has been linked to insulin resistance, obesity, and type 2 diabetes. Dysbiosis, or an unhealthy imbalance in gut bacteria, is common in individuals with obesity and diabetes. However, after metabolic surgery, studies have shown that the composition of gut bacteria undergoes significant changes. These changes often involve an increase in beneficial bacteria and a decrease in harmful bacteria, which can have a positive impact on insulin sensitivity. The beneficial bacteria in the gut produce short-chain fatty acids, SCFAs, that have been shown to improve insulin sensitivity. SCFAs have anti-inflammatory properties and can help to regulate glucose metabolism. Additionally, the gut microbiome influences the production of gut hormones like GLP-1, further improving insulin sensitivity in glucose regulation. The changes in the gut microbiome after metabolic surgery are believed to play an important role in the improvement of insulin sensitivity, particularly in the liver and muscles. As the microbiome shifts towards a healthier balance, insulin resistance decreases, and the body's cells become more responsive to insulin, allowing for better blood sugar control. 4. Improved liver function and insulin sensitivity. The liver plays a central role in glucose metabolism, and insulin resistance in the liver is a key contributor to high blood sugar levels in individuals with type 2 diabetes. One of the benefits of metabolic surgery is the improvement in liver function, which helps to restore normal glucose metabolism. Following surgery, the liver becomes more sensitive to insulin, meaning it can better regulate glucose production and storage. In individuals with obesity and type 2 diabetes, the liver is often overactive in producing glucose, contributing to elevated blood sugar levels. However, after metabolic surgery, the liver's ability to respond to insulin improves, leading to a reduction in excessive glucose production and better blood sugar control. This improvement in liver function is closely linked to the reduction in visceral fat, as fat stored in the liver can impair its ability to respond to insulin. With weight loss following surgery, the liver becomes more efficient in regulating glucose, which helps to lower blood sugar levels and improve overall insulin sensitivity. The impact of insulin sensitivity on glycemic control. The improvements in insulin sensitivity that follow metabolic surgery lead to significant improvements in glycemic control. As the body becomes more responsive to insulin, blood glucose levels stabilize, and insulin secretion becomes more efficient. This means that the pancreas doesn't have to work as hard to produce insulin, and the body's cells are better able to take in glucose from the bloodstream. As a result, patients often experience a significant reduction in blood sugar levels, and many can even achieve normal glucose levels within weeks or months of surgery. For individuals with type 2 diabetes, these improvements in insulin sensitivity can be life-changing. Many patients who once relied on insulin injections or oral diabetes medications may find that they no longer need these treatments as their blood sugar levels stabilize. In some cases, blood sugar levels may even return to normal, reducing or eliminating the need for a diabetes diagnosis. Improved insulin sensitivity also helps to prevent the long-term complications of diabetes, such as cardiovascular disease, kidney damage, and nerve damage. By improving the body's ability to regulate blood sugar, metabolic surgery reduces the risk of these complications and helps patients lead healthier, more fulfilling lives. Long-term effects and sustainability. The long-term effects of improved insulin sensitivity are significant. While weight loss is a key factor in sustaining these benefits, the hormonal and microbiome changes induced by metabolic surgery continue to support insulin sensitivity and glucose regulation long after the procedure. Patients who maintain a healthy lifestyle, including a balanced diet and regular exercise, often continue to experience stable blood sugar levels for years after surgery. Even if weight loss begins to plateau or slow down over time, the improvements in insulin sensitivity often remain, providing long-lasting benefits for blood sugar control. This is one of the reasons why metabolic surgery is considered an effective and sustainable treatment option for people with obesity and type 2 diabetes. A key to better glycemic control. Improved insulin sensitivity is one of the most important and impactful outcomes of metabolic surgery. Through a combination of weight loss, hormonal changes, gut microbiome modifications, and improved liver function. Metabolic surgery helps the body's cells become more responsive to insulin, which leads to better blood sugar control. For individuals with obesity and type 2 diabetes, this improvement in insulin sensitivity can result in significant reductions in blood glucose levels and a lower risk of long-term complications. By restoring the body's ability to regulate blood sugar more effectively, metabolic surgery offers a promising solution for those struggling to manage their diabetes and improve their overall metabolic health. Remission of diabetes after metabolic surgery, a transformative outcome. One of the most remarkable outcomes of metabolic surgery, particularly in patients with type 2 diabetes, is the potential for achieving remission. Remission is defined as the return of normal blood sugar levels without the need for medication. For many individuals with type 2 diabetes, metabolic surgery can significantly improve their health by addressing the root causes of insulin resistance and poor blood glucose control. Studies have shown that between 50% to 80% of patients who undergo metabolic surgery achieve remission, with some even experiencing normal blood sugar levels just weeks after their procedure. This transformative outcome has generated considerable interest in the use of metabolic surgery as a treatment for type 2 diabetes, especially for those who have struggled to control their blood sugar through traditional methods such as medications and lifestyle changes. Diabetes remission does not simply mean a temporary improvement in blood sugar levels. Instead, it refers to the long-term ability of a patient to maintain normal glucose levels without the use of diabetes medications. This has a profound impact on the individual's overall health, as it reduces the risk of complications associated with diabetes, such as cardiovascular disease, kidney damage, nerve damage, and vision problems. For many patients, achieving remission can dramatically improve their quality of life, reduce the burden of managing diabetes, and even eliminate the need for daily medications or insulin injections. The mechanisms that lead to remission after metabolic surgery are complex and multifactorial. While weight loss plays a significant role, it is not the only factor at work. Hormonal changes, improvements in insulin sensitivity, changes in the gut microbiome, and the reduction of visceral fat all contribute to the restoration of normal glucose metabolism. For many patients, these changes occur rapidly after surgery, often before significant weight loss has occurred, which suggests that metabolic surgery impacts diabetes in ways beyond simply reducing body fat. Understanding diabetes remission, what does it really mean? To fully appreciate the significance of remission, it is important to understand what type 2 diabetes entails and how it is traditionally managed. Type 2 diabetes is a condition where the body becomes resistant to insulin, a hormone that helps regulate blood sugar. Insulin resistance means that the cells in the body, especially in the liver and muscles, do not respond properly to insulin, leading to elevated blood sugar levels. Over time, the pancreas compensates by producing more insulin. However, as the disease progresses, the pancreas may become unable to keep up with the demand, resulting in higher blood sugar levels. The goal of diabetes management is to maintain blood sugar levels within a normal range to prevent complications. Traditionally, this is done through a combination of lifestyle changes, such as diet and exercise, and medications, including oral medications or insulin injections. However, achieving and maintaining good blood sugar control can be challenging, especially for individuals who are obese or have long-standing diabetes. Remission of diabetes, as defined in the context of metabolic surgery, means that a patient's blood sugar levels return to normal without the need for diabetes medications. For many people, this is a life-changing event, as it reduces the risk of diabetes-related complications and improves overall health. It's important to note that remission does not necessarily mean that the person is cured of diabetes. Type 2 diabetes is a chronic condition, and remission simply indicates that the disease is well controlled without the need for medication. Patients who achieve remission may still need to continue monitoring their blood sugar levels, and they may need to maintain a healthy lifestyle to prevent the disease from returning. How metabolic surgery achieves remission. Metabolic surgery, including procedures like Roux-en-Y gastric bypass, RYGB, sleeve gastrectomy, and duodenal switch, works by addressing multiple factors that contribute to the development and progression of type 2 diabetes. While the exact mechanisms are not fully understood, research has shown that these surgeries can lead to dramatic improvements in blood sugar control and, in many cases, complete remission. 1. Weight loss and reduction of visceral fat. One of the primary ways that metabolic surgery helps to achieve remission is through significant weight loss. Obesity is a major risk factor for type 2 diabetes, and many individuals with the condition have excess fat, particularly visceral fat, which is stored around the internal organs. Visceral fat is closely linked to insulin resistance, as it produces hormones and inflammatory markers that interfere with the body's ability to use insulin effectively. By significantly reducing body weight, especially visceral fat, metabolic surgery helps to decrease insulin resistance. This allows the body to use insulin more efficiently, leading to better blood sugar control. In fact, many patients experience a normalization of their blood sugar levels soon after surgery, often before significant weight loss occurs. This rapid improvement in glucose control suggests that weight loss is not the only factor contributing to remission, though it remains an important component. 2. Hormonal changes, the role of gut hormones. In addition to weight loss, metabolic surgery leads to significant changes in gut hormones that are crucial in regulating blood sugar. The gut produces several hormones that influence insulin secretion and glucose metabolism, including glucagon-like peptide, 1, GLP-1, and gastric inhibitory peptide, GIP. In individuals with obesity and type 2 diabetes, the production and effectiveness of these hormones are often impaired. Metabolic surgery has been shown to increase the secretion of GLP-1 and GIP, which have beneficial effects on insulin sensitivity and blood sugar control. GLP-1, for example, not only enhances insulin secretion in response to food but also helps to improve insulin sensitivity in the liver and muscles. This means that after surgery, the body becomes more effective at using insulin, which contributes to better glucose regulation. Additionally, metabolic surgery alters other gut hormones that help control appetite, which may also contribute to better blood sugar control. These hormonal changes are thought to occur rapidly after surgery, often leading to significant improvements in blood sugar levels within days or weeks of the procedure. 3. Gut microbiome changes. The gut microbiome, which refers to the trillions of bacteria living in the digestive system, plays a crucial role in metabolism and insulin sensitivity. Research has shown that individuals with obesity and type 2 diabetes often have an imbalance in their gut bacteria, known as dysbiosis. This imbalance can contribute to insulin resistance and poor blood glucose control. Metabolic surgery has been shown to change the composition of the gut microbiome, leading to an increase in beneficial bacteria and a decrease in harmful bacteria. These changes are thought to improve insulin sensitivity in glucose metabolism, contributing to better blood sugar control. The gut microbiome also produces short-chain fatty acids, SCFAs, which have been shown to have anti-inflammatory effects and help regulate glucose metabolism. By improving the gut microbiome, metabolic surgery can further support the remission of diabetes. 4. Alterations in nutrient absorption. Another factor that contributes to remission after metabolic surgery is the alteration of nutrient absorption. Procedures like Roux-en-Y gastric bypass and duodenal switch reroute the small intestine, which reduces the amount of calories and nutrients that are absorbed. This change in nutrient absorption not only leads to weight loss but also influences glucose metabolism. Studies have shown that the changes in nutrient absorption after surgery can lead to improvements in insulin sensitivity and glucose regulation, even before significant weight loss occurs. This suggests that the changes in the gastrointestinal system have a direct impact on blood sugar control and may play a key role in the remission of diabetes. Factors influencing remission rates. While many patients experience significant improvements in blood sugar control after metabolic surgery, the rates of remission can vary. Studies have shown that between 50% and 80% of patients who undergo metabolic surgery achieve remission, but not everyone will experience the same outcome. Several factors can influence the likelihood of achieving remission, including 1. Duration of diabetes. The length of time a person has had type 2 diabetes plays a significant role in the likelihood of achieving remission. Research has shown that individuals who have had diabetes for a shorter period are more likely to achieve remission after metabolic surgery. This is likely because the longer someone has had diabetes, the more likely they are to experience irreversible damage to the pancreas and other organs involved in glucose metabolism. 2. Age and overall health. Younger patients and those who are otherwise healthy tend to have better outcomes after metabolic surgery. Age, overall health, and the presence of other medical conditions can all influence the body's ability to recover and achieve remission. In general, individuals who are in good health and have fewer comorbidities have a higher chance of achieving remission. 3. Type of surgery. Different types of metabolic surgery may have varying success rates in achieving remission. Procedures like Roux-en-Y gastric bypass, RYGB, and duodenal switch tend to have higher rates of remission compared to sleeve gastrectomy or adjustable gastric banding. This may be due to the more significant alterations in the gastrointestinal system that occur with RYGB and duodenal switch, leading to greater improvements in insulin sensitivity and glucose control. 4. Post-surgery lifestyle. While metabolic surgery can lead to significant improvements in blood sugar control, long-term success and remission depend on the patient's ability to maintain a healthy lifestyle after surgery. Adopting a balanced diet, staying active, and following medical advice are all crucial factors in sustaining remission. Patients who make long-term lifestyle changes are more likely to maintain normal blood sugar levels and prevent the recurrence of diabetes. A life-changing outcome. The potential for remission of diabetes after metabolic surgery represents a life-changing outcome for many individuals with type 2 diabetes. Studies have shown that 50% to 80% of patients experience normalization of their blood sugar levels, often without the need for medications. This outcome can dramatically improve the quality of life, reduce the risk of diabetes-related complications, and even eliminate the need for daily medications or insulin injections. Metabolic surgery achieves remission through a combination of mechanisms, including significant weight loss, hormonal changes, improvements in insulin sensitivity, alterations in the gut microbiome, and modifications to nutrient absorption. While not everyone will achieve remission, the potential for significant improvement in blood sugar control makes metabolic surgery a promising treatment option for individuals with obesity and type 2 diabetes. For many patients, remission represents a new beginning, a chance to regain control of their health and live without the constant worry of managing blood sugar levels. With ongoing research and improvements in surgical techniques, the potential for remission will continue to grow, offering hope for millions of individuals living with type 2 diabetes. Benefits beyond blood sugar control: how metabolic surgery enhances overall health. While the primary goal of metabolic surgery, especially for individuals with type 2 diabetes, is to improve blood sugar control, the benefits of these procedures extend far beyond just regulating glucose levels. In fact, metabolic surgery has been shown to have a wide range of positive effects on overall health, particularly in areas related to cardiovascular health, inflammation, and general metabolic function. These additional benefits highlight the comprehensive impact that metabolic surgery can have, offering much more than a simple solution to diabetes management. For many patients, these benefits translate into a better quality of life, improved longevity, and a reduction in the risk of developing serious health conditions associated with obesity and metabolic diseases. Cardiovascular risk reduction, lowering cholesterol and hypertension. One of the most significant ways in which metabolic surgery improves overall health is by reducing cardiovascular risk factors. Type 2 diabetes, obesity, and metabolic syndrome are all strongly associated with an increased risk of developing heart disease, stroke, and other cardiovascular complications. These conditions are often accompanied by additional risk factors such as high blood pressure, hypertension, and abnormal cholesterol levels, both of which can contribute to the development of heart disease. However, studies have consistently shown that patients who undergo metabolic surgery experience substantial improvements in these risk factors, which can dramatically reduce the likelihood of cardiovascular events. High cholesterol and lipid profile improvements. High cholesterol is one of the most common risk factors for cardiovascular disease, and it is often seen in individuals with obesity and type 2 diabetes. Cholesterol is a fatty substance found in the blood, and when levels of bad low-density lipoprotein, LDL, cholesterol are too high, it can lead to the buildup of plaque in the arteries. This plaque narrows the arteries, making it more difficult for blood to flow and increasing the risk of heart attacks and strokes. After metabolic surgery, many patients experience significant improvements in their lipid profile. One of the most common changes is a reduction in LDL cholesterol levels. This is often accompanied by an increase in high-density lipoprotein, HDL, cholesterol, the good cholesterol that helps remove LDL from the bloodstream. Additionally, metabolic surgery can help reduce triglyceride levels, another type of fat in the blood that is associated with an increased risk of cardiovascular disease. These changes in cholesterol levels occur relatively quickly after surgery, often in parallel with improvements in blood sugar control and weight loss. The combined effect of reduced LDL cholesterol, increased HDL cholesterol, and lower triglyceride levels can substantially decrease a patient's risk of heart disease and other cardiovascular issues. For many individuals who have struggled with managing high cholesterol through medication and lifestyle changes, metabolic surgery offers a powerful alternative that not only improves their lipid profile but also enhances their overall heart health. Hypertension, lowering blood pressure for better heart health. Hypertension, or high blood pressure, is another common risk factor for cardiovascular disease, and it is often seen in individuals with obesity and type 2 diabetes. High blood pressure places extra strain on the heart and blood vessels, leading to an increased risk of heart attacks, strokes, kidney damage, and other serious health issues. Like high cholesterol, hypertension is closely linked to metabolic conditions, and it is frequently observed in individuals who are overweight or obese. One of the remarkable effects of metabolic surgery is the improvement in blood pressure regulation. After undergoing procedures such as Roux-en-Y gastric bypass, sleeve gastrectomy, or duodenal switch, many patients experience a significant reduction in their blood pressure levels. In fact, studies have shown that a substantial number of patients who were previously diagnosed with hypertension are able to stop taking blood pressure medications following their surgery, as their blood pressure returns to normal levels. This is particularly important for individuals who have struggled to manage their hypertension through medications or lifestyle changes. The mechanisms behind this improvement in blood pressure are complex, but they are thought to involve a combination of factors, including weight loss, hormonal changes, and improvements in insulin sensitivity. As patients lose weight, particularly abdominal fat, the strain on the heart and blood vessels is reduced, which can lead to a drop in blood pressure. Additionally, metabolic surgery can lead to improvements in the function of the autonomic nervous system, which helps regulate blood pressure. The reduction in insulin resistance and the positive changes in gut hormones, such as GLP-1, also play a role in improving blood pressure control. Heart health and long-term risk reduction. The improvements in cholesterol levels and blood pressure after metabolic surgery are not just short-term changes. Research has shown that these benefits can be sustained for years after the procedure, which translates into a long-term reduction in the risk of heart disease and other cardiovascular complications. In fact, some studies suggest that the risk of heart attack, stroke, and other cardiovascular events can be reduced by as much as 50% or more in patients who undergo metabolic surgery and achieve sustained weight loss and blood sugar control. For many patients, these cardiovascular benefits are life-changing. Not only do they reduce the need for medications to control blood pressure and cholesterol, but they also improve their overall heart health, leading to a better quality of life and a reduced risk of developing life-threatening cardiovascular conditions. Reducing inflammation, a key to improving metabolic health. Inflammation plays a critical role in the development of many chronic diseases, including obesity, type 2 diabetes, cardiovascular disease, and even cancer. Chronic low-grade inflammation is often present in individuals who are obese or have metabolic syndrome, and it contributes to insulin resistance, the accumulation of visceral fat, and the development of other health problems. This type of inflammation is not the same as the short-term inflammation that occurs when the body is fighting an infection. Instead, it is a prolonged and low-level response of the immune system that can cause damage over time. One of the major benefits of metabolic surgery is its ability to reduce inflammation in the body. Research has shown that, after procedures like gastric bypass or sleeve gastrectomy, patients experience significant decreases in levels of inflammatory markers such as C-reactive protein, CRP, and interleukin-6, IL-6. These markers are commonly elevated in individuals with obesity and type 2 diabetes and are associated with an increased risk of developing cardiovascular disease and other chronic conditions. The reduction in inflammation after metabolic surgery is thought to be due to a combination of factors, including weight loss, changes in gut hormones, and improvements in insulin sensitivity. As patients lose weight, particularly visceral fat, the body's inflammatory response is reduced. Additionally, the hormonal changes that occur after surgery, such as increased GLP-1 levels, have anti-inflammatory effects that contribute to overall health improvement. By reducing inflammation, metabolic surgery helps to improve overall metabolic health and reduce the risk of developing a range of chronic diseases. This is particularly important for individuals with type 2 diabetes, as inflammation is a key factor in the development of insulin resistance. The reduction in inflammation not only improves blood sugar control but also contributes to better cardiovascular health, lower cholesterol levels, and a decreased risk of developing other inflammatory-related diseases. Improving overall metabolic health, a comprehensive effect. Beyond blood sugar control, cardiovascular health, and inflammation, metabolic surgery has a broad impact on overall metabolic health. Metabolic health refers to the body's ability to regulate key functions such as glucose metabolism, lipid metabolism, blood pressure, and insulin sensitivity. When metabolic health is compromised, as it often is in individuals with obesity and type 2 diabetes, the risk of developing a range of chronic diseases increases. Metabolic surgery improves overall metabolic health by addressing the root causes of insulin resistance, obesity, and other metabolic dysfunctions. Through weight loss, changes in gut hormones, and improvements in the gut microbiome, metabolic surgery helps to restore balance to the body's metabolic processes. This leads to better glucose regulation, improved fat metabolism, reduced risk of cardiovascular disease, and a reduction in inflammation. The improvements in metabolic health that occur after metabolic surgery are not just about the reduction of risk factors like high cholesterol and hypertension. They also lead to an improvement in energy levels, better sleep, increased physical activity, and an overall improvement in well-being. Many patients report feeling more energized, having more stamina, and being able to engage in activities that they were once unable to do due to the limitations imposed by obesity and diabetes. A comprehensive path to health improvement. Metabolic surgery offers far-reaching benefits that extend well beyond blood sugar control. By improving cardiovascular risk factors, reducing inflammation, and enhancing overall metabolic health, these surgeries have the potential to transform the lives of individuals with obesity and type 2 diabetes. The reduction in high cholesterol, hypertension, and chronic inflammation, along with the improvement in insulin sensitivity, provides a holistic approach to health improvement. These benefits not only reduce the risk of developing severe complications but also improve the quality of life and increase longevity. For many patients, metabolic surgery represents more than just a way to control their diabetes, it offers a chance to reclaim their health and well-being. With sustained weight loss, improved heart health, and reduced inflammation, patients can look forward to a healthier future, free from the burden of chronic disease. As research continues and the benefits of metabolic surgery become more widely recognized, it is likely that more individuals will benefit from this transformative approach to health improvement. Risks and complications of metabolic surgery, understanding the challenges. Metabolic surgery, while offering profound benefits for many patients dealing with obesity and type 2 diabetes, is not without its risks and potential complications. As with any surgical procedure, there are inherent dangers involved, and it is crucial for individuals considering these surgeries to be fully aware of both the immediate and long-term risks. While metabolic surgery has helped transform the lives of many by improving health outcomes, including better blood sugar control, weight loss, and reduced cardiovascular risk, it is important to understand that these surgeries come with potential risks that may affect both the short-term and long-term health of patients. This section explores the risks and complications that can arise from metabolic surgery, breaking them down into both the immediate surgical risks and the long-term health concerns that may develop as a result of the procedure. Understanding these risks is essential for patients to make informed decisions and to prepare for what lies ahead after surgery. Immediate surgical risks. Metabolic surgeries, such as Roux-en-Y gastric bypass, sleeve gastrectomy, duodenal switch, and adjustable gastric banding, are major operations that carry their own set of immediate surgical risks. These risks are inherent in any surgery, regardless of its specific purpose. For patients undergoing metabolic surgery, it is important to recognize these potential dangers and to ensure that they are being monitored and managed properly by a skilled surgical team. The most common immediate risks include infection, bleeding, and adverse reactions to anesthesia. Infection. One of the most common risks following any type of surgery, including metabolic surgery, is infection. Surgery involves making incisions in the body, which can introduce bacteria into the surgical site. In the case of metabolic surgery, the risks of infection are heightened because of the invasive nature of the procedure, which often involves cutting and rerouting parts of the stomach and intestines. An infection can occur at the site of the incision or inside the body, particularly in areas where the gastrointestinal tract has been altered. Infections can range from mild to severe, with symptoms including redness, swelling, warmth around the incision site, fever, and pain. In some cases, an infection may require further surgical intervention to clean the area and remove infected tissue. Antibiotics are often prescribed to prevent infections after surgery, but in some cases, additional treatments or even a hospital stay may be necessary if an infection develops. Bleeding. Bleeding is another potential complication associated with metabolic surgery. As with any surgery that involves cutting or manipulating internal organs, there is always the risk of damaging blood vessels, leading to internal bleeding. This bleeding can occur during the surgery itself or in the days following the procedure. While surgeons take great care to minimize bleeding, some amount of blood loss is inevitable, and in rare cases, excessive bleeding may occur. Patients who experience significant bleeding may need a blood transfusion to replace lost blood, and in some cases, additional surgery may be necessary to locate and stop the source of bleeding. It is important for patients to be monitored closely after surgery to ensure that any signs of bleeding are detected early and addressed promptly. Anesthesia risks. Another risk associated with metabolic surgery is the potential for adverse reactions to anesthesia. Anesthesia is used to numb the body during surgery, and while it is generally safe, there are always risks involved. Some individuals may have allergies or sensitivities to certain types of anesthesia, which can lead to complications such as difficulty breathing, nausea, vomiting, or a drop in blood pressure. Although rare, severe allergic reactions or complications related to anesthesia can be life-threatening. To minimize these risks, patients are typically evaluated prior to surgery to ensure they are suitable candidates for anesthesia. Surgeons and anesthesiologists work together to carefully monitor patients during the procedure to minimize any potential issues related to anesthesia. Long-term risks and complications. While the immediate risks associated with metabolic surgery are significant, the long-term risks are just as important to consider. These risks are typically related to changes in the digestive system, nutrient absorption, and metabolic function that occur as a result of the surgery. While many patients experience significant improvements in their health following surgery, others may face long-term complications that require ongoing management and care. Dumping syndrome. One of the most well-known long-term complications associated with metabolic surgery, particularly after Roux-en-Y gastric bypass, is a condition called dumping syndrome. This occurs when food moves too quickly from the stomach into the small intestine, leading to symptoms such as nausea, vomiting, diarrhea, dizziness, and rapid heart rate. Dumping syndrome is typically triggered by consuming foods that are high in sugar or fat, which can cause an overload of sugar to enter the small intestine too quickly. The condition can be uncomfortable and, in some cases, may cause significant distress for patients. While dumping syndrome is usually temporary, it can be a long-term issue for some patients, particularly those who have undergone gastric bypass or other procedures that alter the normal flow of food through the digestive system. In many cases, dietary changes can help manage the symptoms, such as avoiding high-sugar foods and eating smaller, more frequent meals. However, in some instances, patients may need additional treatments or interventions to alleviate the symptoms of dumping syndrome. Malnutrition. One of the most serious long-term risks of metabolic surgery is malnutrition. Because these surgeries reduce the size of the stomach and alter the way food is absorbed in the intestines, patients may not be able to consume enough nutrients to meet their body's needs. The reduced stomach size and the rerouting of the intestines can make it difficult for patients to absorb essential vitamins, minerals, and other nutrients from food. Over time, this can lead to deficiencies in important nutrients such as iron, calcium, vitamin B12, and vitamin D. Malnutrition can have serious consequences for a patient's health, including fatigue, weakness, bone loss, anemia, and neurological problems. To minimize the risk of malnutrition, patients who undergo metabolic surgery are often required to take supplements for the rest of their lives to ensure they are getting the necessary nutrients. Regular follow-up appointments with a healthcare provider are essential to monitor nutrient levels and make adjustments to supplementation as needed. In some cases, patients may also need to undergo additional treatments, such as intravenous, for nutrient supplementation, if deficiencies become severe. However, with proper care, nutritional support, and ongoing monitoring, the risk of severe malnutrition can often be managed. Hypoglycemia, low blood sugar. Another potential long-term risk of metabolic surgery, particularly after procedures like gastric bypass, is hypoglycemia, or low blood sugar. After the surgery, some patients may experience episodes of low blood sugar, which can cause symptoms such as shakiness, sweating, confusion, weakness, and fainting. Hypoglycemia occurs when the body produces too much insulin in response to the rapid digestion of food, leading to an excessive drop in blood sugar. In some cases, hypoglycemia can be severe and require medical intervention. To prevent hypoglycemia, patients are often advised to follow a carefully planned diet, eat smaller meals throughout the day, and monitor their blood sugar levels regularly. If left untreated, severe hypoglycemia can lead to unconsciousness or other serious health issues. In some cases, patients may need to make adjustments to their diabetes medications, particularly insulin, to prevent hypoglycemic episodes. Conclusion: weighing the risks and benefits. Metabolic surgery offers significant benefits for individuals struggling with obesity and type 2 diabetes, including improved blood sugar control, weight loss, and a reduction in the risk of cardiovascular disease. However, it is important to recognize that, like any major surgery, metabolic surgery carries potential risks and complications that patients must be aware of. These risks include both immediate surgical complications, such as infection and bleeding, as well as long-term issues like dumping syndrome, malnutrition, and hypoglycemia. While many of these complications can be managed through careful monitoring, dietary changes, and medical interventions, it is essential for patients to have a clear understanding of the potential challenges they may face after surgery. By working closely with their healthcare team, patients can minimize the risks associated with metabolic surgery and ensure that they are receiving the support they need to maintain long-term health and well-being. Ultimately, the decision to undergo metabolic surgery should be made after careful consideration of the risks and benefits, with the support of a knowledgeable medical team. For many patients, the benefits of improved health and quality of life far outweigh the potential risks, but it is important to approach the surgery with a clear understanding of what to expect both immediately after the procedure and in the years that follow. Nutritional management post-surgery. Lifelong supplementation with vitamins and minerals is necessary to avoid deficiencies. Diet progresses from liquids to solid food over several weeks. Nutritional management post-surgery, ensuring lifelong health and wellness. Undergoing metabolic surgery is a significant life-changing decision, especially for individuals suffering from obesity and type 2 diabetes. While this surgery offers transformative health benefits, such as weight loss, improved blood sugar control, and a reduction in the risk of heart disease, there are essential changes that need to be made to ensure that patients maintain their health long after the operation. One of the most crucial aspects of post-surgery care is managing nutrition effectively to prevent complications, deficiencies, and other health problems that may arise as a result of the surgery. Metabolic surgery, such as gastric bypass, sleeve gastrectomy, or duodenal switch, alters the digestive system in profound ways. These surgeries reduce the size of the stomach, limit the amount of food that can be consumed, and sometimes reroute the small intestine. As a result, the body's ability to absorb essential nutrients, including vitamins, minerals, and proteins, is compromised. Nutritional management post-surgery is, therefore, not just an optional part of recovery, it is a critical and lifelong responsibility that ensures the patient's well-being. Lifelong vitamin and mineral supplementation, a non-negotiable requirement. One of the most important aspects of post-surgery nutritional management is the lifelong need for vitamin and mineral supplementation. After metabolic surgery, the body's ability to absorb nutrients from food is significantly reduced due to changes in the digestive system. The reduced stomach size means that patients can no longer consume large quantities of food, and certain parts of the intestine may no longer be able to absorb nutrients as effectively as before. Without supplementation, individuals could develop serious nutrient deficiencies that can lead to a host of health problems, including anemia, bone disease, and neurological complications. The most common deficiencies observed in patients after metabolic surgery are in vitamins and minerals such as vitamin B12, vitamin D, calcium, iron, and folic acid. These nutrients play essential roles in the body's functioning, and without adequate amounts, a patient's overall health could deteriorate. Vitamin B12. Vitamin B12 is one of the most critical nutrients for individuals who have undergone metabolic surgery. It is vital for nerve function, the production of red blood cells, and DNA synthesis. After surgery, the body's ability to absorb B12 from food is compromised due to the reduced stomach size and changes in the intestine. Vitamin B12 is primarily absorbed in the stomach through a process that requires intrinsic factor, a protein produced in the stomach. In patients who undergo gastric bypass surgery, a large portion of the stomach is bypassed, which reduces the production of intrinsic factor and hinders the absorption of vitamin B12. To prevent a deficiency, most patients are required to take vitamin B12 supplements for life, either in the form of oral tablets or sublingual forms that dissolve under the tongue for better absorption. In some cases, patients may need B12 injections if their deficiency becomes severe. Vitamin D and calcium. Vitamin D and calcium are closely linked and are essential for maintaining strong bones and overall skeletal health. Calcium is necessary for bone density, nerve function, and muscle contraction, while vitamin D helps the body absorb calcium. After surgery, patients may have difficulty absorbing both calcium and vitamin D due to changes in the digestive system, leading to an increased risk of bone loss, fractures, and conditions such as osteoporosis. To mitigate these risks, patients are advised to take calcium and vitamin D supplements for life. The form and dosage of these supplements are carefully monitored by healthcare providers to ensure proper absorption and to prevent side effects such as kidney stones. In some cases, patients may need higher doses of calcium and vitamin D than the average recommended amount to meet their nutritional needs. Iron. Iron is another nutrient that can become deficient after metabolic surgery. Iron is essential for the production of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. A deficiency in iron can lead to anemia, causing symptoms such as fatigue, weakness, dizziness, and shortness of breath. After surgery, the body's ability to absorb iron from food is limited, particularly in procedures that involve rerouting the intestines, like gastric bypass surgery. Patients are often prescribed iron supplements in the form of ferrous sulfate or other forms that are easier to absorb. It is also essential to note that iron supplements should be taken separately from calcium supplements, as calcium can interfere with iron absorption. Regular monitoring of iron levels through blood tests is important to prevent anemia and ensure patients are receiving the appropriate dosage of iron. Folic acid. Folic acid, also known as vitamin B9, is another essential nutrient for post-surgery patients. It plays a crucial role in cell division, DNA synthesis, and the production of red blood cells. Deficiency in folic acid can lead to megaloblastic anemia, a condition where red blood cells become abnormally large and inefficient at carrying oxygen. Patients who have undergone bariatric surgery, especially gastric bypass, may be at risk for folic acid deficiency, as the altered digestive system affects its absorption. Folic acid supplementation is typically recommended to prevent this deficiency. Many multivitamins prescribed after surgery contain folic acid, but in some cases, additional folic acid supplementation may be necessary, particularly for patients who experience low levels during follow-up visits. Diet progression, from liquids to solid foods. Another critical aspect of post-surgery nutrition is the gradual progression from liquids to solid food. Immediately after surgery, the stomach is much smaller, and the digestive system is still healing. To ensure that patients are not overloading their systems and to promote optimal healing, a carefully planned dietary progression is followed. The diet typically progresses in several phases, starting with clear liquids and gradually moving to more solid foods over the course of several weeks. Phase 1, Clear liquids. During the first phase after surgery, patients are restricted to clear liquids. These include water, broth, clear juices, and sugar-free drinks. The purpose of this phase is to give the stomach time to heal and adjust to its new size. Clear liquids are easy to digest and provide minimal calories, which helps prevent the stomach from being overwhelmed by too much food at once. In addition to hydration, clear liquids provide the body with some nutrients, although they are typically low in protein, vitamins, and minerals. For this reason, patients may be instructed to consume protein shakes or liquid nutritional supplements to help meet their protein needs during this phase. Phase 2, Full liquids. After a few days to a week on clear liquids, patients progress to full liquids. Full liquids include the same liquids as clear liquids but with the addition of milk, protein shakes, smoothies, and cream soups. These foods are more substantial and provide more nutrients, including protein, which is essential for the body's healing process. This phase typically lasts for a few weeks, depending on the patient's healing and tolerance levels. While full liquids are more nutrient-dense, patients are still limited to small portions, as the stomach is still adjusting to its smaller size. It is crucial that patients consume liquids that are low in sugar to avoid dumping syndrome and to ensure that they are getting adequate protein and vitamins to support healing. Phase 3, Pureed foods. Once the patient has tolerated full liquids for several weeks, they can begin to incorporate pureed foods into their diet. Pureed foods are foods that have been blended into a smooth, soft consistency, making them easier to digest and pass through the small stomach pouch. This phase typically includes foods like mashed potatoes, pureed vegetables, yogurt, and soft fruits. Pureed foods are still easy to digest, but they provide more substance and nutrition than liquids alone. The patient will also be encouraged to continue consuming protein-rich foods, such as pureed chicken, fish, or eggs. The goal during this phase is to ensure that the patient is meeting their protein and calorie needs while continuing to allow the stomach time to heal. Phase 4, Soft Foods. The next stage of the diet involves the introduction of soft foods. These are foods that are easy to chew and swallow, such as scrambled eggs, soft fruits, cooked vegetables, and ground meats. Soft foods help the patient transition to a more normal diet while still preventing the stomach from being overwhelmed by harder-to-digest foods. During this phase, patients must still be mindful of portion sizes, as their stomach remains smaller than it was before the surgery. Phase 5, Solid Foods. After several weeks of transitioning through the softer food phases, patients can finally move on to solid foods. At this stage, the patient should be able to eat most foods, but in smaller amounts. It is important to note that certain foods may be difficult to digest, especially in the early post-surgery period. These include fibrous foods, tough meats, and foods that are high in sugar or fat. It is also critical to focus on eating slowly and chewing food thoroughly to ensure that it is properly digested. Many patients find that they can no longer consume large meals, and it is common to feel full after eating just a small portion. Conclusion: the importance of lifelong nutritional care. Nutritional management following metabolic surgery is an essential aspect of ensuring long-term success and health. Patients must be prepared to make lifelong changes to their diet and supplement regimen to prevent deficiencies and maintain their overall well-being. From the initial liquid diet to the gradual introduction of solid foods, the nutritional journey after surgery is a carefully planned process designed to help the body heal, adjust, and thrive. By adhering to a well-balanced, nutrient-dense diet, taking necessary supplements, and maintaining regular follow-up visits with healthcare providers, patients can optimize their health and enjoy the life-changing benefits of metabolic surgery. Although it may take time to adjust to these changes, the long-term rewards of improved health, increased energy, and better quality of life make the effort well worth it. Psychological considerations: navigating the emotional and mental shifts post-surgery. Metabolic surgery, such as gastric bypass, sleeve gastrectomy, or other bariatric procedures, is a life-altering intervention. While the physical changes that occur after surgery, such as rapid weight loss, improved blood sugar levels, and reduced cardiovascular risks, are often the first things people notice, the psychological and emotional adjustments that patients undergo are equally significant. In fact, the mental and emotional transitions can be just as challenging as the physical ones, if not more so. While metabolic surgery offers a promising solution to obesity and related health conditions, it can bring with it a range of psychological considerations that patients must navigate. The drastic changes in eating habits, body image, and lifestyle can stir a mix of emotions, including excitement, fear, sadness, and even anxiety. These emotional responses can be overwhelming, and for many patients, professional psychological support becomes an essential component of their journey to recovery. Understanding the psychological impact of surgery and seeking adequate emotional support can play a pivotal role in ensuring long-term success and well-being. The psychological impact of surgery, a major life transition. For individuals struggling with obesity, the decision to undergo metabolic surgery is often one of great significance, born from years of attempting to manage their weight through diet, exercise, or other less invasive treatments. Surgery promises a resolution to what has often been a lifelong battle. Yet, despite its promise, the psychological toll of undergoing such an intensive procedure should not be underestimated. After surgery, patients face a drastically different relationship with food. They are no longer able to consume large quantities of food or enjoy it in the same way they did before. This can lead to feelings of loss or deprivation. Many patients may feel grief over the foods they can no longer indulge in or may feel overwhelmed by the strict eating guidelines they must follow. The physical changes, such as rapid weight loss, may also prompt emotional responses as patients confront their changing bodies. Adjusting to new eating habits, the emotional strain of food restriction. Before surgery, patients may have developed a set of eating habits that were often tied to their emotions and mental well-being. Food could have served as a comfort during stressful times, a source of joy during social gatherings, or even a coping mechanism for sadness or anxiety. After surgery, this relationship with food shifts drastically. The portion sizes are smaller, the types of food they can consume are more limited, and the pace at which they eat changes. These alterations, though beneficial for their health, can be emotionally difficult to process. The loss of food as a source of comfort or celebration can lead to feelings of sadness, frustration, and even depression. Some patients may mourn the ability to eat in the same way they did before, while others may struggle with the guilt of not adhering to their new dietary guidelines. Additionally, patients may feel alienated from family and friends who may still be able to enjoy meals as they once did, further highlighting the sense of isolation that can occur after surgery. Psychologically, these changes can feel like a significant loss. The social and cultural rituals surrounding food, such as family gatherings, celebrations, and dining out, can become complicated and distressing. Patients may find themselves grieving for these aspects of their old lives, which were intertwined with eating habits, and struggle to redefine their relationship with food in a healthier way. Body image and self-esteem, the emotional roller coaster of physical transformation. One of the most significant psychological challenges following metabolic surgery is dealing with changes in body image. Rapid weight loss can be both exciting and disorienting. For patients who have struggled with their weight for years, seeing the numbers on the scale drop can feel like a triumph. However, along with the physical transformation, there are often emotional hurdles that need to be addressed. For many individuals, obesity has been a source of stigma and low self-esteem for much of their lives. They may have faced judgment, discrimination, or negative stereotypes because of their size. While losing weight can bring a sense of empowerment, it may also bring up complicated emotions. As patients lose weight, they might feel a mixture of pride and vulnerability. Their changing bodies may lead to feelings of discomfort or self-consciousness, as they try to adjust to their new appearance. Some individuals may feel a sense of guilt or anxiety about their success, worried that others may not understand or appreciate the effort they've put into transforming their health. On the other hand, some patients may experience a kind of identity crisis. For years, they have been used to thinking of themselves in a particular way, and their identity has been closely tied to their body size. The sudden change in appearance can lead to confusion or discomfort, as they navigate this new phase of their lives. The changes in body image might feel unreal or unsettling, and some patients might struggle with accepting their new appearance, even if it is healthier or more physically attractive. These emotional responses are completely normal, but they can be challenging to manage without support. The risk of emotional eating, coping mechanisms and psychological support. Another psychological consideration after metabolic surgery is the risk of emotional eating or developing new coping mechanisms. Prior to surgery, many individuals turn to food as a way to cope with emotions such as stress, sadness, boredom, or anxiety. While surgery limits food intake, patients may still face emotional challenges that might tempt them to rely on food for comfort. Without proper psychological support, patients may develop unhealthy coping strategies. Some may struggle with a condition known as binge eating disorder after surgery, even though they are physically unable to consume large portions of food. This can manifest as eating large amounts of food too quickly or eating beyond the point of fullness. The urge to overeat may be a subconscious attempt to manage stress, boredom, or other emotional triggers. This behavior can lead to frustration and feelings of failure, as the surgery may not seem to provide the expected relief from emotional struggles. In many cases, these emotional eating patterns can be mitigated with psychological counseling or therapy. Learning healthier ways to cope with stress and emotions is an important part of the recovery process after surgery. Support groups or individual therapy sessions can help patients understand their emotional triggers, address underlying psychological issues, and develop alternative coping mechanisms that do not involve food. Psychological support, a key component of success. Given the complex emotional and psychological challenges that patients face after metabolic surgery, psychological support is crucial for ensuring long-term success. Research has shown that patients who engage in therapy or counseling before and after surgery tend to have better outcomes in terms of both weight loss and emotional well-being. Addressing the psychological aspects of the surgery helps individuals adjust more successfully to their new lifestyle and eating habits, and it can also improve their overall quality of life. Therapy can be particularly helpful in addressing body image issues, self-esteem challenges, and emotional eating patterns. Cognitive behavioral therapy, CBT, is one of the most common forms of therapy used for post-surgery patients, as it helps individuals identify negative thought patterns and replace them with healthier, more constructive ways of thinking. Therapy can also teach patients how to navigate difficult situations, such as family gatherings, holidays, or social events, without turning to food as a coping mechanism. Support groups are also an invaluable resource for many individuals. Being part of a group of people who understand the challenges of post-surgery life can help patients feel less isolated. In these groups, individuals can share their experiences, offer emotional support, and learn from others who have faced similar struggles. Sharing feelings of doubt, frustration, or joy with others who understand can be incredibly therapeutic and can foster a sense of community and belonging. The role of family and friends, emotional support systems. In addition to professional therapy and support groups, the role of family and friends cannot be overstated in the emotional recovery process. The support of loved ones can be a major factor in helping patients adjust to their new lifestyle. Family and friends who understand the challenges of the post-surgery journey can offer encouragement, celebrate milestones, and provide a sense of stability. They can also help patients stay accountable to their health goals, whether it's maintaining a healthy diet or exercising regularly. However, it's essential for family and friends to understand the emotional complexities involved in metabolic surgery. They should be mindful of the psychological impact the surgery can have, as well as the changes in eating habits and body image. Offering empathy and understanding, rather than judgment or unsolicited advice, can make a significant difference in how patients cope with their new lifestyle. Embracing a holistic approach to post-surgery recovery. The psychological considerations following metabolic surgery are just as important as the physical aspects of recovery. The emotional and mental challenges that patients face, such as adjusting to new eating habits, coping with changes in body image, and managing emotional eating, can significantly impact their overall success and well-being. To ensure long-term success, it is vital that patients receive the psychological support they need, whether through therapy, support groups, or the support of family and friends. By addressing the psychological impact of metabolic surgery, patients can better navigate the challenges of their new lifestyle. With the right support and strategies in place, they can not only achieve their physical health goals but also foster a positive relationship with their body, their health, and their future. Success rates of metabolic surgery, beyond weight loss. Metabolic surgery, which includes procedures such as gastric bypass, sleeve gastrectomy, and other bariatric surgeries, is gaining widespread recognition for its ability to help patients lose weight and significantly improve health outcomes. However, success in the context of these surgeries is not simply measured by how much weight a person loses. It extends to broader goals, such as achieving sustained control over blood sugar levels, reducing reliance on diabetes medications, improving overall metabolic health, and enhancing quality of life. These success metrics are far more comprehensive and nuanced than the traditional view of weight loss alone. In recent years, studies and real-world experiences have demonstrated that metabolic surgery can lead to life-changing improvements in many aspects of health, particularly for individuals with type 2 diabetes and obesity. For these patients, surgery offers more than a quick fix for weight issues. It provides a long-term solution that can reset the body's metabolic processes, normalize blood sugar levels, and reduce the need for medications. It's important to understand that success post-surgery is not just about the physical transformation that occurs in terms of body weight, but also the way in which the surgery improves the overall health and well-being of individuals over time. The broader definition of success in metabolic surgery. When we talk about the success of metabolic surgery, it's easy to focus solely on the number on the scale. After all, patients often undergo these surgeries to lose weight and reduce their risk of obesity-related diseases. However, the true measure of success extends far beyond mere weight loss. For patients with type 2 diabetes, the most significant improvement comes in the form of glycemic control, how well the body regulates blood sugar levels. Many individuals with obesity and type 2 diabetes face the challenge of insulin resistance, where the body's cells become less responsive to the insulin produced by the pancreas. As a result, blood sugar levels remain elevated, leading to a range of complications such as kidney damage, cardiovascular problems, nerve damage, and more. Metabolic surgery, by promoting significant weight loss and altering the body's hormonal and metabolic functions, has been shown to improve insulin sensitivity and even lead to remission of type 2 diabetes in some cases. However, the success of metabolic surgery isn't limited to glycemic control alone. Another key success metric is the reduction in reliance on diabetes medications. For many patients, diabetes medications can become a lifelong commitment, often requiring adjustments as the disease progresses. After surgery, however, a significant number of patients are able to significantly reduce or even eliminate the need for medication. This reduction not only improves the patient's quality of life by minimizing medication side effects, but it also has financial benefits by reducing healthcare costs associated with managing chronic conditions. Weight loss, a tangible indicator of success. Weight loss remains one of the most visible and tangible outcomes of metabolic surgery, and for good reason. Obesity is a major risk factor for many chronic diseases, including type 2 diabetes, hypertension, cardiovascular disease, and certain types of cancer. As such, one of the primary reasons individuals choose to undergo metabolic surgery is to lose weight in order to reduce these health risks. On average, patients can expect to lose between 50 to 70% of their excess weight within the first year following surgery, depending on the procedure and their individual commitment to the post-surgery lifestyle changes. This weight loss is not only beneficial for reducing the physical strain on the body but also plays a key role in improving overall metabolic health. For patients with obesity-related diseases, such as type 2 diabetes or high blood pressure, weight loss often leads to significant improvements in these conditions as well. However, weight loss should not be seen as the sole marker of success. While losing weight can bring immediate physical benefits, such as improved mobility, reduced joint pain, and enhanced physical appearance, the long-term success of metabolic surgery is more accurately determined by its ability to sustain these benefits over time, along with the improvements in glycemic control and reduced need for medications. Sustained glycemic control, the heart of success for diabetic patients. For patients with type 2 diabetes, the impact of metabolic surgery on blood sugar control is perhaps the most important factor in determining success. Type 2 diabetes is a chronic condition characterized by elevated blood sugar levels due to insulin resistance, and it is often managed with lifestyle changes, oral medications, and sometimes insulin injections. However, despite best efforts, many people with type 2 diabetes struggle to maintain stable blood sugar levels, leading to complications that can significantly affect their quality of life. One of the remarkable aspects of metabolic surgery is the speed at which blood sugar levels improve post-surgery. In many cases, patients see improvements in blood sugar control within days or even weeks of the procedure, often before they have lost a significant amount of weight. This rapid improvement in glycemic control is due to several factors, including hormonal changes that affect insulin sensitivity and a reduction in fat mass that lessens the burden on the body's metabolic system. Studies have shown that up to 80% of patients who undergo metabolic surgery experience a marked improvement in their blood sugar levels. For many, this means that their diabetes becomes much easier to manage, and some even experience full remission, defined as normal blood sugar levels without the need for medication. In fact, for a significant number of patients, metabolic surgery offers the possibility of reversing type 2 diabetes to the point where they no longer need to rely on insulin or oral medications. This is a game changer for individuals who have been living with the burden of managing a chronic condition for years or even decades. Reduction in reliance on medications, a financial and emotional win. Another key component of success after metabolic surgery is the reduction in reliance on medications, especially for individuals managing type 2 diabetes. Managing diabetes with medication can be costly and can come with a host of side effects. Insulin therapy, for example, requires careful monitoring of blood sugar levels, frequent injections, and adjustments to dosage, which can be burdensome both physically and emotionally. For many patients who undergo metabolic surgery, the reduction in the need for medications is one of the most rewarding aspects of the procedure. The significant improvements in insulin sensitivity and blood sugar control mean that fewer medications are required to maintain normal glucose levels. In some cases, patients are able to stop taking diabetes medications altogether, which can provide immense relief both physically and financially. Beyond the financial savings, the emotional benefits of reducing or eliminating medications cannot be overstated. For many individuals with diabetes, taking multiple medications every day can feel like a constant reminder of their condition. The prospect of reducing or stopping these medications can bring a sense of freedom, empowerment, and hope for the future. Quality of life and psychological benefits. Success after metabolic surgery is not just measured in physical health terms, there are significant improvements in a patient's quality of life as well. The reduction in obesity-related health risks, such as hypertension, high cholesterol, and sleep apnea, can lead to a more active and fulfilling life. Patients report feeling better overall, with more energy to engage in daily activities, improved mobility, and a greater sense of well-being. The psychological impact of surgery can also be profound. Many patients experience a boost in self-esteem and body image as they lose weight and improve their physical health. The ability to participate more fully in social activities and physical exercise can enhance their overall mental health, reducing feelings of depression and anxiety that often accompany obesity and chronic illness. For many, the surgery becomes a new lease on life, offering a chance to start afresh with improved health, self-confidence, and a brighter outlook. Long-term success, maintenance and lifestyle changes. While the results of metabolic surgery are often dramatic, maintaining these successes over the long term requires ongoing commitment to lifestyle changes. Weight loss achieved through surgery can be significant, but it must be maintained through a combination of healthy eating, regular physical activity, and adherence to post-surgery guidelines, including nutritional supplementation. Patients who succeed in maintaining their weight loss and blood sugar control post-surgery are those who embrace these lifestyle changes and remain committed to making health a top priority. Follow-up care is crucial for long-term success, as it ensures that patients stay on track with their diet, exercise, and mental health management. Ongoing psychological support is also essential for addressing any emotional challenges that may arise, such as difficulties with body image, emotional eating, or adjusting to new social dynamics. A holistic approach to measuring success. In conclusion, the success of metabolic surgery cannot be fully captured by weight loss alone. While losing excess weight is undoubtedly an important and visible aspect of the surgery's benefits, the true success lies in the sustained improvements in metabolic health, particularly blood sugar control and the reduction of medication reliance. Achieving and maintaining normal blood sugar levels, with or without the use of diabetes medications, is often the most significant marker of success for patients with type 2 diabetes. Moreover, the success of metabolic surgery also extends to improvements in overall health, quality of life, and psychological well-being. The ability to live a more active, fulfilling life, free from the physical limitations and emotional burdens of obesity and chronic disease, is a profound achievement that goes beyond the physical changes in the body. Ultimately, the success of metabolic surgery is a multifaceted journey that encompasses not only weight loss but also the restoration of health, empowerment, and hope for a brighter future. Long-term outcomes of metabolic surgery, a journey of remission and recurrence. Metabolic surgery, particularly for individuals with type 2 diabetes and obesity, has emerged as a transformative medical intervention, helping patients not only lose weight but also experience significant improvements in their metabolic health. The long-term outcomes of these surgeries, such as gastric bypass, sleeve gastrectomy, and duodenal switch, are often profound, with many patients achieving remission of type 2 diabetes, sometimes even within days or weeks of the procedure. However, as with any medical intervention, long-term outcomes can vary from patient to patient, and while some people experience lasting benefits, others may face challenges that affect their ability to maintain remission or long-term weight loss. Understanding these outcomes is crucial for both patients and healthcare providers, as it provides insight into the necessary lifestyle adjustments and follow-up care that contribute to long-lasting success. What is remission after metabolic surgery? For individuals living with type 2 diabetes, remission means something different from a simple cure. Remission of type 2 diabetes post-surgery is defined as achieving normal blood sugar levels without the need for diabetes medications. This means that the body's insulin production and usage are sufficiently normalized, and blood glucose levels are within the normal range. Achieving remission can be a major milestone for patients, many of whom have struggled for years with blood sugar management through diet, exercise, and multiple medications. While remission is often considered an extraordinary benefit of metabolic surgery, it is important to note that it is not a permanent cure for diabetes. Remission indicates that the diabetes is under control, but long-term success depends on various factors, including weight management, lifestyle changes, and continued medical monitoring. Studies show that between 50% to 80% of patients who undergo metabolic surgery experience remission of type 2 diabetes within the first year, with some maintaining remission for several years. This remission is usually achieved as a result of rapid weight loss, improved insulin sensitivity, and changes in gut hormones, all of which work together to normalize blood sugar levels. The first few years, the period of greatest benefit. The first few years after metabolic surgery are typically marked by the most significant improvements in health outcomes. During this time, many patients experience a dramatic decrease in their blood sugar levels, often even before losing substantial amounts of weight. This can be attributed to several factors, including changes in gut hormones, such as glucagon-like peptide 1, GLP-1, which play a significant role in improving insulin sensitivity. Additionally, rapid weight loss in the initial months after surgery reduces fat accumulation in the liver and pancreas, further improving insulin function and leading to better blood sugar control. During this initial period, patients often experience a reduction or complete cessation of diabetes medications. For some, this can be a life-changing experience. It's common for people who have been on insulin therapy or oral diabetes medications for years to suddenly find themselves no longer needing them. This not only improves their quality of life by reducing medication side effects but also provides significant financial relief, as diabetes management can be costly over the long term. Additionally, improvements in other aspects of health, such as cholesterol levels, blood pressure, and overall energy levels, are often observed. Patients who have struggled with obesity-related comorbidities such as sleep apnea, hypertension, and joint pain find that these conditions improve as their weight decreases, leading to enhanced physical mobility and overall well-being. This initial period of health improvement is often described as a honeymoon phase, where patients feel energized by their newfound health and the positive outcomes they are experiencing. The risks of weight regain and diabetes recurrence. While many patients experience significant improvements in their health following metabolic surgery, the journey doesn't always remain smooth. One of the key risks to long-term success is weight regain. Over time, some individuals may begin to regain the weight they lost after surgery, which can result in the return of metabolic complications, including diabetes. Several factors contribute to weight regain after metabolic surgery. One of the most significant is poor adherence to post-surgery lifestyle recommendations, such as maintaining a healthy diet and engaging in regular physical activity. Although the surgery helps reduce the stomach size and reroutes the digestive process, it doesn't eliminate the need for ongoing commitment to healthy living. Some patients may revert to old eating habits or fail to follow the dietary guidelines provided by their healthcare teams, leading to weight regain. Other factors that can influence weight regain include psychological factors such as emotional eating or lack of adequate mental health support, changes in metabolism over time, and physical changes in the body. For example, as patients lose weight, the body's metabolism may slow down, which can make it more difficult to continue losing weight or maintain the weight loss long-term. Additionally, some patients may experience issues with hunger and cravings, which can make it challenging to stay on track with a healthy diet. Weight regain, especially in the years following surgery, is often associated with a recurrence of type 2 diabetes. If patients regain a significant portion of their weight, insulin resistance can return, leading to elevated blood sugar levels. This is particularly problematic for patients who were able to achieve remission after surgery. While metabolic surgery can provide significant improvements in blood sugar control, it is important to recognize that these benefits are closely linked to maintaining a healthy weight. If the weight is regained, the benefits to blood sugar regulation may diminish, and diabetes can return. Managing diabetes recurrence after metabolic surgery. Diabetes recurrence after metabolic surgery can be distressing for patients, particularly for those who had been in remission for several years. However, it's important to remember that recurrence doesn't mean the surgery has failed, rather, it indicates the need for renewed effort in managing weight and blood sugar. Many patients can still regain control of their diabetes through lifestyle changes, such as dietary adjustments, increased physical activity, and, if necessary, the reintroduction of medications. The key to preventing or managing diabetes recurrence after surgery is early intervention. If a patient begins to notice signs of blood sugar elevation, such as increased thirst, frequent urination, or fatigue, reaching out to their healthcare provider early can make a significant difference. Catching diabetes recurrence early allows for adjustments to be made before the situation worsens. A patient may need to return to medication for diabetes management or undergo more intensive lifestyle interventions. In many cases, healthcare providers recommend that patients who have undergone metabolic surgery continue to receive regular follow-up care. These appointments help track weight, blood sugar levels, and overall health, allowing for early detection of any changes. Ongoing support, including nutritional counseling, physical activity guidance, and psychological support, is crucial for maintaining the positive effects of surgery in preventing weight regain and diabetes recurrence. Sustaining long-term success, the role of ongoing lifestyle modifications. The key to sustaining long-term success after metabolic surgery is a commitment to a healthy lifestyle. Although the surgery itself provides an initial boost in terms of weight loss and blood sugar control, maintaining these benefits requires ongoing effort and adjustments. After surgery, patients are typically advised to follow a structured diet plan that includes eating smaller portions, focusing on nutrient-dense foods, and avoiding high-calorie, low-nutrient foods. Additionally, regular physical activity is encouraged to help maintain weight loss, improve insulin sensitivity, and enhance overall health. Many patients find that support groups and counseling are essential for maintaining their mental and emotional well-being. The psychological aspect of the journey is just as important as the physical aspect, and some individuals may need help managing issues such as body image concerns, emotional eating, or adjusting to new social dynamics after significant weight loss. Moreover, ongoing medical monitoring is essential to ensure that patients stay on track with their health goals. Regular checkups, blood sugar tests, and nutritional assessments help identify any areas where patients may need additional support. By staying engaged with their healthcare team and adhering to their post-surgery guidelines, patients can maximize their chances of maintaining long-term success and avoiding the recurrence of diabetes. A lifelong journey with metabolic surgery. The long-term outcomes of metabolic surgery offer a promising path to better health for many individuals struggling with obesity and type 2 diabetes. While many patients experience significant and lasting improvements, including remission of type 2 diabetes, the journey doesn't end with surgery. Long-term success is dependent on ongoing commitment to a healthy lifestyle, regular medical follow-up, and psychological support. It's important for patients to recognize that while metabolic surgery provides an incredible tool for weight loss and blood sugar control, it's not a one-time fix. Success in the long run requires continued effort to maintain the benefits of surgery and prevent complications, including weight regain and diabetes recurrence. By staying focused on healthy eating, physical activity, and regular medical care, many patients can enjoy the long-term benefits of metabolic surgery, experiencing sustained remission of type 2 diabetes and improved overall health for years to come. Cost-effectiveness of metabolic surgery, a long-term investment in health. Metabolic surgery, particularly for individuals with type 2 diabetes and obesity, is often viewed through the lens of initial costs, which can seem overwhelming. The procedure itself is expensive due to factors such as hospital stays, the surgical team, and post-operative care. However, when evaluating the long-term impact, the financial burden of metabolic surgery must be understood not only in terms of upfront costs but also the broader economic benefits it offers over time. This includes its potential to drastically reduce long-term healthcare expenses by mitigating complications related to diabetes and other obesity-associated conditions. By improving patients' quality of life and minimizing the need for ongoing medical treatments, metabolic surgery presents a cost-effective approach that benefits both patients and the healthcare system in the long run. Understanding the initial cost of metabolic surgery. Before delving into the cost-effectiveness of metabolic surgery, it's important to understand its initial cost, which can be substantial. The procedure itself, depending on the type of surgery performed, e.g., Roux-en-Y gastric bypass, sleeve gastrectomy, or duodenal switch, can cost several thousand to tens of thousands of dollars. This cost typically includes pre-surgical consultations, diagnostic tests, the surgery itself, anesthesia, post-operative care, and follow-up visits. For individuals with insurance, some of these costs may be covered, but for many people, especially those who are uninsured or underinsured, the financial burden can be significant. In addition to the direct costs of the surgery, there are also indirect costs to consider. Patients may need to take time off work to recover, which can result in lost income. Furthermore, there are potential costs related to complications that could arise, such as infections or nutritional deficiencies, which may require additional medical care. These initial expenses can make metabolic surgery seem prohibitive for many patients, especially when compared to more traditional, less invasive treatments like lifestyle changes or medication. Despite these upfront costs, the real financial impact of metabolic surgery becomes apparent when we consider the long-term healthcare costs that the surgery helps to prevent or reduce. The savings come in several areas, primarily by minimizing the severe complications associated with obesity and type 2 diabetes. Reducing the long-term healthcare burden of type 2 diabetes. Type 2 diabetes is a chronic condition that requires ongoing management and is associated with numerous complications if left untreated. These complications include cardiovascular disease, kidney failure, nerve damage, vision problems, and amputations. Managing diabetes typically requires a combination of medications, regular monitoring of blood glucose levels, and, in severe cases, insulin therapy. The long-term costs of managing type 2 diabetes can be astronomical. In the United States, for example, it's estimated that the annual cost of managing diabetes per patient is over $13,000, with the vast majority of these costs being related to complications and hospitalizations. Metabolic surgery has been shown to improve blood sugar control in a significant number of patients, often leading to remission of type 2 diabetes. This reduction or complete cessation of diabetes medications can offer substantial savings. For many patients, diabetes management costs decrease dramatically after surgery because they no longer need to purchase medications or deal with the hospitalizations and doctor visits associated with poorly controlled diabetes. In fact, several studies have demonstrated that metabolic surgery can reduce the cost of managing diabetes by up to 50% or more over a period of several years. Furthermore, by achieving remission or improving glycemic control, metabolic surgery helps prevent the development of diabetes-related complications. The prevention of complications such as cardiovascular disease, kidney failure, and blindness directly translates into reduced long-term healthcare costs. For instance, the cost of treating heart disease or kidney failure associated with diabetes can reach tens of thousands of dollars annually, not to mention the physical and emotional toll on the patient. Preventing other obesity-related conditions. Beyond diabetes, obesity itself is linked to a wide range of comorbidities that contribute to long-term healthcare costs. Conditions such as hypertension, sleep apnea, osteoarthritis, fatty liver disease, and certain cancers are more prevalent in individuals with obesity. These conditions require ongoing medical care, including medications, surgeries, and specialist consultations, all of which add to the financial burden on both patients and the healthcare system. Metabolic surgery plays a pivotal role in addressing these conditions by promoting significant weight loss. As patients lose weight after surgery, many experience improvements in their blood pressure, sleep apnea, and joint pain. For instance, patients who have had weight loss surgery often see a reduction in their blood pressure, leading to less reliance on antihypertensive medications. Similarly, individuals with sleep apnea may no longer need to rely on costly treatments like CPAP machines or continuous doctor visits for managing the condition. Joint pain, particularly in the knees and hips, often diminishes after significant weight loss, reducing the need for pain medications and surgical interventions like joint replacements. These improvements in obesity-related health conditions not only enhance the quality of life for patients but also significantly reduce the need for ongoing medical treatments. The resulting savings in medication, doctor visits, and surgeries can be substantial, making metabolic surgery a cost-effective option for many individuals suffering from obesity and its related comorbidities. The economic impact on the healthcare system. From a healthcare system perspective, the economic impact of metabolic surgery extends beyond individual patient savings. Obesity and its associated complications place a tremendous financial burden on healthcare systems around the world. In the United States, for example, obesity is estimated to cost over $170 billion annually in direct healthcare costs, including treatments for obesity-related diseases. These costs are spread across various sectors, including hospitals, outpatient care, pharmaceuticals, and long-term care facilities. By reducing the incidence of obesity-related diseases, metabolic surgery can help alleviate this financial strain. In fact, several studies have demonstrated that for every dollar spent on bariatric surgery, there is a return on investment in the form of reduced healthcare spending on conditions like diabetes, hypertension, and heart disease. This reduction in healthcare expenditures can be seen in both public and private healthcare sectors, as fewer patients require intensive care for obesity-related conditions. In addition to reducing direct medical costs, metabolic surgery can also lead to broader societal savings. For example, when patients experience improvements in health, they are more likely to return to work and be productive members of society. The reduction in absenteeism and the improved ability to work and function in daily life contributes to the overall economic productivity of the population. Furthermore, the prevention of disability and the need for long-term care can lead to significant cost savings in terms of both public welfare programs and private insurance plans. The cost of inaction, the economic burden of obesity and diabetes. While metabolic surgery has an upfront cost, the cost of inaction is far greater in the long term. Without intervention, individuals with obesity and type 2 diabetes face a lifetime of medical treatments, hospitalizations, and reduced productivity. The long-term costs of managing these conditions through medications, surgeries, and emergency care can quickly exceed the cost of metabolic surgery. This is particularly true for individuals who are unable to achieve sufficient weight loss through lifestyle changes alone, or who experience significant complications related to diabetes and obesity. Moreover, as the prevalence of obesity and type 2 diabetes continues to rise globally, the burden on healthcare systems will only increase. The World Health Organization has identified obesity as a major public health issue, with nearly 40% of adults worldwide classified as obese. If these trends continue, the economic burden of obesity-related diseases will continue to escalate, further emphasizing the need for cost-effective solutions like metabolic surgery. A long-term investment in health and savings. While the initial cost of metabolic surgery can be significant, its long-term cost-effectiveness cannot be overstated. By improving diabetes control, reducing obesity-related health conditions, and lowering the need for expensive medical treatments, metabolic surgery offers significant financial benefits in the years following the procedure. The savings in healthcare costs, both for patients and the healthcare system as a whole, far outweigh the upfront investment. For individuals struggling with obesity and type 2 diabetes, metabolic surgery presents a transformative opportunity not only to improve their health but also to achieve long-term financial relief. By addressing the root causes of these conditions and preventing costly complications, metabolic surgery offers a sustainable solution that can lead to better health outcomes and a brighter, more financially secure future. The cost-effectiveness of metabolic surgery makes it a wise investment for both patients and healthcare systems alike, providing long-term savings and improved quality of life for all involved. Current guidelines on metabolic surgery, a growing consensus among endocrinology and diabetes societies. Metabolic surgery, which includes a variety of surgical interventions aimed at weight loss and the improvement of metabolic health, has emerged as a critical tool in the treatment of individuals with obesity and type 2 diabetes. Historically, surgery was viewed as a last resort option for those who failed to achieve adequate results through conventional methods such as lifestyle changes, medication, and exercise. However, over the past decade, this perspective has shifted dramatically. Today, leading endocrinology and diabetes societies worldwide are increasingly recommending metabolic surgery not only as an option but often as a first-line treatment for patients with obesity and type 2 diabetes, especially those who are unable to manage their condition with medications or other non-invasive treatments. This shift in medical opinion reflects the growing body of evidence that demonstrates the effectiveness of metabolic surgery in treating both obesity and type 2 diabetes, as well as its ability to improve or even induce remission of these conditions. Metabolic surgery is now recognized as a comprehensive approach that addresses the underlying causes of type 2 diabetes, such as insulin resistance and excess fat accumulation, rather than just focusing on weight loss. As such, this shift in guidelines represents a broader understanding of the importance of metabolic health and the ways in which surgical interventions can provide lasting improvements in quality of life for patients with these chronic conditions. The role of endocrinology and diabetes societies in shaping guidelines. Endocrinology and diabetes societies are at the forefront of shaping the current medical consensus surrounding metabolic surgery. These organizations, which include the American Diabetes Association, ADA, the European Association for the Study of Diabetes, EASD, and the International Diabetes Federation, IDF, play a critical role in developing guidelines that inform clinicians and healthcare providers about the most effective treatments for type 2 diabetes and obesity. Their recommendations are based on extensive research, clinical trials, and real-world data that highlight the benefits of metabolic surgery for patients struggling with these conditions. For many years, these societies advocated for lifestyle modifications, such as diet and exercise, and medications as the primary approaches to managing type 2 diabetes. However, as evidence emerged suggesting that metabolic surgery could offer more effective and lasting results, these organizations began to reevaluate their stance. By 2016, the American Diabetes Association, for example, updated its guidelines to recommend that bariatric surgery be considered for adults with type 2 diabetes who have a body mass index, BMI, of 30 or higher, a shift from the previous guideline, which had restricted surgery recommendations to individuals with a BMI of 35 or higher. This change was largely due to the significant evidence suggesting that metabolic surgery can dramatically improve blood sugar control and even lead to remission in patients with diabetes. The European Association for the Study of Diabetes, EASD, followed suit, recognizing that metabolic surgery was a viable and highly effective treatment for obesity-related type 2 diabetes, particularly in cases where other treatments had failed. The EASD's position was further reinforced by the results of several key clinical trials, such as the STAMPEDE trial, which demonstrated that patients who underwent bariatric surgery had significantly better outcomes in terms of weight loss and blood sugar control compared to those who relied solely on medication and lifestyle changes. These updates in guidelines reflect a growing recognition of the broader, multifaceted benefits of metabolic surgery. The improvements in blood sugar regulation, weight loss, and the reduction of obesity-related complications, including hypertension, sleep apnea, and cardiovascular disease, have made it clear that metabolic surgery offers more than just a solution for weight loss. It is, in fact, a treatment that addresses the underlying metabolic dysfunction associated with type 2 diabetes and obesity. How the guidelines have evolved over time. In the past, the general consensus surrounding metabolic surgery was that it was a treatment of last resort, considered only for individuals with severe obesity, BMI greater than or equal to 40, who had been unsuccessful with other methods. Over time, as research has continued to evolve and shed light on the long-term benefits of metabolic surgery, medical societies have expanded their guidelines to include individuals with lower levels of obesity and those who are struggling with poorly controlled type 2 diabetes. In the early stages, the main focus was on weight loss and the prevention of obesity-related complications. As more studies demonstrated the profound effects of metabolic surgery on blood sugar regulation and insulin sensitivity, diabetes societies began to shift their focus toward the metabolic benefits of surgery as well. This led to the development of more inclusive guidelines that not only recommend metabolic surgery for patients with a BMI greater than or equal to 40 but also for those with a BMI of 30 or higher, especially when diabetes is not well controlled through lifestyle changes and medications. For example, the 2016 guidelines from the American Diabetes Association, ADA, recommended metabolic surgery as a treatment option for adults with a BMI of 30 or greater, provided they had type 2 diabetes that was not effectively controlled with lifestyle changes and pharmacologic treatment. This was a significant departure from earlier guidelines, which had been more restrictive. The 2016 update was based on emerging data showing that patients with lower BMI levels could still experience significant benefits from metabolic surgery, particularly in terms of glycemic control. Similarly, the 2019 position statement from the American Society for Metabolic and Bariatric Surgery, ASMBS, expanded the recommendations for metabolic surgery to include individuals with BMI greater than or equal to 30, provided they had uncontrolled type 2 diabetes and were not achieving adequate results with other treatments. This was based on accumulating evidence suggesting that bariatric surgery could lead to remission of type 2 diabetes, even in patients with a lower BMI. This evolution in guidelines reflects a broader understanding of the underlying causes of obesity and diabetes, including the role of insulin resistance, fat accumulation, and hormonal imbalances. It also reflects a greater awareness of the limitations of traditional approaches to managing these conditions, such as medications and lifestyle changes, which may not be effective for all patients, particularly those with severe insulin resistance or significant obesity-related complications. The growing body of evidence supporting metabolic surgery. The increased recommendation of metabolic surgery by endocrinology and diabetes societies is largely driven by the growing body of evidence supporting its effectiveness in treating type 2 diabetes and obesity. Clinical trials, observational studies, and real-world data have consistently shown that metabolic surgery can lead to substantial improvements in blood sugar control, insulin sensitivity, and weight loss, even in patients with long-standing type 2 diabetes. For instance, the previously mentioned STAMPEDE trial demonstrated that patients who underwent bariatric surgery achieved greater weight loss and better blood sugar control than those who received medical treatment alone. In fact, some patients were able to stop taking diabetes medications entirely, and others experienced complete remission of their diabetes. These results were particularly compelling for patients who had been diagnosed with type 2 diabetes for many years and had not been able to achieve adequate control with oral medications or insulin therapy. Other studies have shown that metabolic surgery can lead to significant improvements in the overall metabolic profile of patients, including reductions in blood pressure, cholesterol levels, and markers of inflammation. These improvements in cardiovascular health are particularly important given that individuals with type 2 diabetes and obesity are at a higher risk for heart disease and other cardiovascular complications. The benefits of metabolic surgery extend beyond just weight loss and blood sugar control. Patients who undergo bariatric surgery often experience improved quality of life, reduced pain from conditions like osteoarthritis, and better overall health. These improvements have been shown to lead to increased productivity, fewer sick days, and a lower risk of disability, all of which contribute to the overall economic and social benefits of metabolic surgery. Key takeaways from the current guidelines. The growing support for metabolic surgery by endocrinology and diabetes societies reflects a fundamental shift in the way that obesity and type 2 diabetes are understood and treated. Metabolic surgery is no longer viewed as a last resort measure for morbidly obese patients but as an essential tool in managing type 2 diabetes, even for those with lower levels of obesity. Today, many of the world's leading diabetes societies recommend metabolic surgery for patients with a BMI of 30 or higher, particularly when other treatments have failed to provide adequate results. This change in guidelines is based on a wealth of evidence demonstrating the profound impact of metabolic surgery on blood sugar control, insulin sensitivity, and overall metabolic health. It represents a broader understanding of the metabolic nature of obesity and diabetes, as well as a recognition of the limitations of traditional treatments in managing these complex and chronic conditions. As more patients benefit from metabolic surgery and its positive long-term outcomes, it is likely that the guidelines will continue to evolve, further solidifying its role as a first-line treatment for type 2 diabetes and obesity. In conclusion, the increasing endorsement of metabolic surgery by leading endocrinology and diabetes societies represents a pivotal moment in the treatment of type 2 diabetes and obesity. By considering surgery as an early and effective intervention for patients with these conditions, healthcare providers can offer patients a more comprehensive and sustainable solution that addresses the underlying causes of their diseases, improves their quality of life, and reduces the long-term healthcare costs associated with these chronic conditions. The current guidelines, which reflect a more nuanced and evidence-based approach to treatment, will continue to shape the future of obesity and diabetes care, providing patients with better opportunities for long-term health and wellness. Limitations and challenges of metabolic surgery, addressing the complexities. Metabolic surgery, while offering significant benefits to many individuals with obesity and type 2 diabetes, is not a universally applicable solution. While the surgical procedures have proven effective for some patients, they come with certain limitations and challenges that need to be carefully considered. These limitations stem from a variety of factors, including medical risks, psychological readiness, and practical barriers like accessibility and affordability. Although the growing body of evidence supports the use of metabolic surgery, understanding these constraints is crucial for patients, healthcare providers, and policymakers. It is important to recognize that metabolic surgery is not a one-size-fits-all approach and that there are certain patients for whom surgery may not be the most appropriate treatment option. Surgical risks, a crucial factor to consider. One of the most significant limitations of metabolic surgery is the inherent risk associated with any surgical procedure. While the success rates of these surgeries are high, they are not without potential complications. Surgical risks include infection, bleeding, blood clots, and adverse reactions to anesthesia. These risks are particularly concerning for individuals with additional health conditions, such as heart disease, hypertension, or compromised immune systems, who may face a higher likelihood of experiencing complications during or after surgery. For such patients, the potential benefits of surgery must be carefully weighed against the risks. Postoperative complications can also arise, even in patients who are otherwise healthy. For example, some individuals may experience issues such as infection at the incision site, delayed wound healing, or internal bleeding. The most common long-term complications of metabolic surgery include nutritional deficiencies, which can occur as a result of the reduced stomach capacity and altered digestive system. Nutrient absorption is often limited following these surgeries, and patients must commit to lifelong supplementation of essential vitamins and minerals to avoid deficiencies, such as vitamin B12, iron, and calcium. Inadequate supplementation can lead to serious health issues like anemia, bone loss, or neuropathy. Furthermore, metabolic surgery can result in other complications, such as dumping syndrome, a condition where food moves too quickly through the stomach and intestines, leading to nausea, sweating, and diarrhea. This can occur particularly after the Roux-en-Y gastric bypass, RYGB, surgery, where the stomach is significantly reduced in size, and the digestive process is altered. Hypoglycemia, low blood sugar, is another concern, especially after gastric bypass procedures, where changes in gut hormones can affect insulin regulation. These complications underscore the importance of thorough pre-surgical screening, careful patient selection, and post-surgery follow-up to ensure that patients are adequately supported throughout the process. In addition to the risks associated with the surgery itself, patients need to be aware of the potential for requiring additional surgeries down the line. Some individuals may experience complications such as bowel obstruction, hernias, or issues related to the surgical modifications of the stomach and intestines. For some patients, revisional surgery may be required, either to address complications or to improve the effectiveness of the original procedure. These revisional surgeries carry their own risks, including those associated with any additional surgeries. Psychological readiness, a key factor in success. Another important limitation of metabolic surgery is the psychological readiness of patients to undergo such a significant life change. Metabolic surgery is not merely a physical procedure, it is a transformative experience that requires patients to adapt to new eating habits, lifestyle changes, and long-term psychological shifts. The success of the surgery is not solely dependent on the surgical procedure itself but also on how well the patient is prepared to change their behavior and approach to food. Psychological readiness and emotional support are crucial components in ensuring long-term success. Not all patients may be psychologically prepared to make these changes. Surgery can affect an individual's relationship with food, as many patients experience a decreased ability to consume large amounts of food due to the reduced stomach capacity after surgery. This significant change in eating habits can cause emotional distress, as food is often tied to cultural, social, and emotional experiences. For some patients, this shift can lead to feelings of deprivation or loss, which may result in psychological challenges such as depression, anxiety, or disordered eating behaviors. Moreover, some individuals may struggle with the drastic changes in body image that accompany significant weight loss. While losing weight can improve overall health and quality of life, it can also lead to challenges in how patients perceive themselves. In some cases, patients may experience issues with body dysmorphia or have difficulty adjusting to their new appearance. This can be especially challenging for individuals who have spent many years being overweight and may have internalized negative self-image as a result. As a result, psychological assessments and counseling before and after surgery are essential for ensuring that patients are mentally and emotionally prepared for the changes they will undergo. Behavioral therapy, support groups, and individual counseling sessions can provide patients with the necessary tools to address emotional eating, stress management, and body image concerns. Psychological support can also help patients maintain long-term adherence to the dietary and lifestyle changes necessary to ensure the success of metabolic surgery. In some cases, patients with underlying psychological conditions, such as depression, anxiety, or eating disorders, may need additional support or treatment before undergoing surgery. These conditions can impact a patient's ability to make lasting changes to their eating habits and lifestyle, and addressing these concerns before surgery can help reduce the risk of failure or complications. Accessibility, a barrier to treatment. Another significant challenge related to metabolic surgery is accessibility. While the availability of surgical treatments for obesity and type 2 diabetes is increasing globally, there are still many regions, particularly in low-income countries or rural areas, where access to these procedures is limited. In some regions, there may be a shortage of qualified surgeons or specialized healthcare facilities equipped to perform metabolic surgeries safely. As a result, many patients may face long waiting times or have to travel significant distances to access these treatments, which can be both time-consuming and costly. In addition to the logistical challenges, many patients may face barriers related to the financial cost of the procedure. Although metabolic surgery can result in long-term cost savings by reducing the need for diabetes medications and preventing complications associated with obesity, the upfront cost of surgery can be prohibitively expensive. In many countries, metabolic surgery is not covered by public health insurance, leaving patients to pay out of pocket. Even in countries where insurance may cover part of the procedure, patients may still be required to pay a significant portion of the costs. This can create a substantial financial burden, particularly for individuals with limited resources or those who lack adequate health insurance. For individuals living in countries where healthcare systems are not well developed or where surgery is not part of the standard treatment protocol, the financial and logistical barriers to accessing metabolic surgery can be even more pronounced. Without the option of surgery, many patients may be left with few alternatives to manage their obesity and diabetes, which can worsen their health outcomes over time. Furthermore, there is the issue of education and awareness. In some areas, there may be limited understanding or awareness of metabolic surgery and its potential benefits. Patients may not be fully informed about the options available to them or may not have access to the necessary resources to explore surgery as a treatment option. In these cases, healthcare providers and advocacy organizations play a critical role in educating patients about the benefits and risks of metabolic surgery and helping them navigate the complex healthcare systems to access the treatment they need. Affordability, the economic impact of surgery. The economic aspect of metabolic surgery is a crucial consideration, not only for individual patients but also for healthcare systems. As previously mentioned, the initial cost of metabolic surgery can be a significant barrier for many patients. The cost of the surgery itself, combined with the need for ongoing follow-up care, nutritional counseling, and potentially lifetime supplementation, can add up to a considerable financial commitment. In addition, the potential for complications, such as nutritional deficiencies or the need for revisional surgeries, can increase the overall cost of treatment. However, while the upfront costs may be high, the long-term savings associated with metabolic surgery should not be overlooked. By reducing the need for ongoing diabetes medications, preventing complications associated with obesity, and improving overall health, metabolic surgery can ultimately lead to substantial cost savings for healthcare systems. For example, patients who experience improved blood sugar control and weight loss after surgery may require fewer hospitalizations, have a lower incidence of heart disease, and experience fewer complications related to diabetes. This can result in lower healthcare utilization and fewer resources spent on managing chronic conditions over time. Nevertheless, in regions where healthcare systems are underfunded or where there is a lack of insurance coverage for metabolic surgery, patients may not have access to these long-term benefits. The inability to afford the surgery or the associated care can lead to a cycle of worsening health outcomes and higher healthcare costs, ultimately placing an additional strain on both patients and the healthcare system. Overcoming the limitations and challenges. While metabolic surgery offers significant benefits to many patients, it is not without its limitations and challenges. Surgical risks, psychological readiness, and barriers related to accessibility and affordability all play a crucial role in determining whether this treatment option is appropriate for a given patient. It is important for healthcare providers to assess these factors carefully, ensuring that patients are well informed and adequately prepared for the physical, emotional, and financial demands of surgery. Additionally, efforts must be made to improve accessibility and affordability of metabolic surgery, particularly in underserved regions, so that more patients can benefit from this life-changing treatment. As research and healthcare practices continue to evolve, it is likely that new techniques and approaches will emerge to address some of these limitations, making metabolic surgery safer, more accessible, and more effective for a broader range of patients. Until then, it is crucial to approach metabolic surgery with a balanced understanding of both its potential and its limitations, ensuring that patients receive the best possible care and support throughout their journey. Metabolic surgery, often referred to as bariatric or weight loss surgery, has emerged as a powerful treatment for individuals with obesity and type 2 diabetes. Over recent decades, it has gained significant attention in the medical community for its ability to deliver life-changing benefits, particularly when compared to more traditional approaches, such as intensive medical therapy. The term intensive medical therapy refers to a combination of medications, lifestyle changes, and ongoing monitoring that aim to manage and control conditions like diabetes and obesity. While medical therapy has long been the standard approach for treating these conditions, the effectiveness of metabolic surgery often surpasses that of medical interventions, offering patients improved outcomes, both in terms of glycemic control and weight loss. In this discussion, we will explore why metabolic surgery tends to outperform intensive medical therapy in certain aspects, examine the reasons behind its success, and consider the implications of this shift in medical practice. By analyzing the benefits, potential drawbacks, and underlying mechanisms at play, it becomes clear that metabolic surgery may offer patients with obesity and diabetes a more definitive solution, particularly when conventional methods fall short. The limitations of intensive medical therapy. Intensive medical therapy, typically involving lifestyle modifications such as diet, exercise, and medications, has been the cornerstone of treatment for type 2 diabetes and obesity. Medications like metformin, sulfonylureas, insulin, and other drugs help to regulate blood sugar levels, while lifestyle interventions aim to reduce weight and improve overall health. These treatments can be effective for many patients, especially when they are able to adhere to the prescribed regimen and make lasting changes in their daily habits. However, despite their effectiveness in managing symptoms and preventing immediate complications, intensive medical therapy does not always offer a long-term solution. One of the major limitations of this approach is the difficulty many patients face in maintaining consistent weight loss. While medications and lifestyle changes can lead to temporary weight reduction, many individuals find it challenging to sustain these improvements over time. Factors such as emotional eating, stress, lack of motivation, and the difficulty of maintaining an exercise routine often hinder long-term success. Additionally, medications can have side effects, and insulin therapy, for instance, may even lead to weight gain in some patients, counteracting the intended benefits. Another challenge is the need for ongoing adjustments to medications. Over time, some patients may experience a decrease in the effectiveness of their medications, requiring higher doses or additional drugs to control blood sugar levels. This escalation can become burdensome, both for the patient and the healthcare system, as it can lead to higher costs and greater complexity in managing the condition. Furthermore, even with aggressive treatment regimens, some patients fail to achieve adequate glycemic control, resulting in complications such as neuropathy, retinopathy, kidney disease, and cardiovascular problems. These limitations have led researchers and healthcare providers to explore alternative treatments, such as metabolic surgery, which could offer more durable and impactful solutions for managing obesity and type 2 diabetes. The role of metabolic surgery in improving glycemic control. Metabolic surgery, especially procedures like gastric bypass, sleeve gastrectomy, and duodenal switch, has been shown to provide superior glycemic control compared to intensive medical therapy. One of the key reasons for this is the impact of surgery on insulin sensitivity and the mechanisms of blood sugar regulation. After metabolic surgery, patients often experience an immediate and significant reduction in blood sugar levels, sometimes even before they begin to lose substantial amounts of weight. This is a phenomenon that sets metabolic surgery apart from medical therapies. Research has demonstrated that metabolic surgery leads to improvements in insulin sensitivity and the body's ability to process glucose. The mechanisms behind these improvements are not entirely understood but are believed to be related to changes in gut hormones, such as GLP-1, glucagon-like peptide 1, and GIP, gastric inhibitory polypeptide, which play critical roles in regulating insulin secretion and glucose metabolism. After surgery, the altered digestive tract produces these hormones in higher quantities, which in turn enhances insulin sensitivity and helps to lower blood glucose levels. This hormonal shift is one of the key factors that makes metabolic surgery so effective at managing type 2 diabetes. Furthermore, unlike intensive medical therapy, which focuses primarily on managing blood sugar through medication and lifestyle changes, metabolic surgery addresses the root causes of obesity and insulin resistance. By reducing the size of the stomach and altering the digestive process, surgery significantly changes the way the body responds to food and nutrients. This leads to a more profound and lasting impact on both weight loss and blood sugar regulation. In addition to improving insulin sensitivity, metabolic surgery also results in a decrease in overall body fat. Obesity is a major driver of insulin resistance, and by reducing fat mass, metabolic surgery helps to alleviate the strain that excess weight places on the body's ability to process insulin effectively. As a result, many patients see their need for diabetes medications significantly reduced or even eliminated entirely after surgery. For patients who are struggling to manage their diabetes through medical therapy, the prospect of surgery offering a more permanent solution can be a game changer. The superior weight loss achieved through surgery. Another area where metabolic surgery outshines intensive medical therapy is in its ability to provide significant and sustained weight loss. Weight loss is a critical aspect of managing both obesity and type 2 diabetes, as it helps to reduce the risk of complications and improves overall health. While medical therapies can result in some weight loss, the magnitude and sustainability of this weight loss are typically far greater following metabolic surgery. One of the primary reasons for this difference is the surgical alteration of the gastrointestinal tract, which leads to long-term changes in appetite and food intake. For example, the gastric bypass procedure reduces the stomach size, limiting the amount of food a person can consume at one time. This restriction helps patients feel fuller more quickly, making it easier for them to consume fewer calories. Additionally, the altered digestive system leads to changes in gut hormones that reduce hunger and cravings, further promoting weight loss. Unlike intensive medical therapy, which requires constant self-discipline and ongoing effort to maintain weight loss, metabolic surgery provides a more permanent physical solution. After surgery, many patients experience a steady and sustainable reduction in weight, often losing a significant percentage of their excess weight within the first year following the procedure. This weight loss is often accompanied by improvements in comorbid conditions, such as hypertension, high cholesterol, and sleep apnea, which are common in individuals with obesity and diabetes. The superior weight loss achieved through metabolic surgery has a profound impact on the management of type 2 diabetes. As weight decreases, insulin sensitivity improves, and blood sugar levels stabilize, leading to better overall diabetes control. Studies have shown that patients who undergo metabolic surgery experience not only significant weight loss but also greater improvements in glycemic control compared to those who rely solely on intensive medical therapy. Long-term outcomes, a more permanent solution. While intensive medical therapy can help manage obesity and type 2 diabetes, the long-term outcomes are often less stable and reliable compared to metabolic surgery. One of the major challenges with medical therapy is that the effects tend to diminish over time. Many patients who initially experience improvements in blood sugar levels and weight loss eventually face difficulties in maintaining these gains. This can be attributed to factors such as medication side effects, lifestyle challenges, and the progressive nature of type 2 diabetes. In contrast, metabolic surgery offers a more durable solution. Studies have shown that patients who undergo metabolic surgery maintain substantial weight loss and improved glycemic control for several years, with some even experiencing long-term remission of their diabetes. While there are exceptions, and some patients may experience weight regain or a recurrence of diabetes, the long-term success rates for metabolic surgery tend to be higher than those for intensive medical therapy. For example, a study published in the journal JAMA Surgery found that after 5 years, nearly 70% of patients who underwent gastric bypass surgery maintained at least 50% of their weight loss, compared to a much lower percentage of patients who relied on medical therapy alone. Additionally, the rate of diabetes remission after surgery remained high over the long term, with many patients maintaining normal blood sugar levels without the need for medication. This long-term effectiveness is a significant advantage of metabolic surgery. For patients who have struggled with obesity and diabetes for years, the prospect of a more permanent solution provides a sense of hope and empowerment. Unlike intensive medical therapy, which requires ongoing adjustments and can often feel like a never-ending battle, metabolic surgery provides a more lasting resolution to the challenges posed by obesity and diabetes. The cost-effectiveness of metabolic surgery. While the initial cost of metabolic surgery can be high, studies have shown that it can be a cost-effective long-term solution when compared to intensive medical therapy. This is because metabolic surgery not only helps to control diabetes and reduce weight but also reduces the need for ongoing medical treatments, hospitalizations, and management of diabetes-related complications. In the long run, patients who undergo metabolic surgery may require fewer diabetes medications, have fewer hospital visits, and experience fewer complications related to obesity and diabetes. This can result in substantial cost savings for both patients and the healthcare system. Furthermore, by preventing or reducing the incidence of diabetes-related complications, such as heart disease, kidney failure, and nerve damage, metabolic surgery can lead to a better quality of life and a reduced burden on healthcare resources. Metabolic surgery's superior role in managing obesity and type 2 diabetes. In conclusion, metabolic surgery offers a promising alternative to intensive medical therapy for patients with obesity and type 2 diabetes. By addressing the root causes of these conditions and providing superior weight loss and glycemic control, metabolic surgery can provide patients with a more effective and lasting solution than traditional methods. While it is not without its risks and limitations, the long-term benefits of metabolic surgery, particularly in terms of weight loss, improved insulin sensitivity, and the potential for diabetes remission, make it a compelling option for many individuals struggling with these chronic conditions. As research continues to explore the mechanisms behind the success of metabolic surgery, it is likely that new techniques and approaches will emerge, further improving the outcomes for patients. For now, however, metabolic surgery remains one of the most effective treatments for obesity and type 2 diabetes, offering patients the possibility of a healthier and more fulfilling life. The field of metabolic surgery, particularly in the treatment of obesity and type 2 diabetes, has evolved significantly over the past few decades. As the understanding of the mechanisms behind the success of these procedures deepens, researchers are looking toward future advancements that could make these treatments even more effective, accessible, and tailored to individual patients. The future directions in research for metabolic surgery are focused on two major areas: identifying genetic markers to predict surgical outcomes and investigating non-surgical interventions that can mimic the effects of metabolic surgery. These advancements could fundamentally change the way healthcare providers approach the treatment of obesity and type 2 diabetes, offering patients a wider array of options and improving outcomes. Exploring genetic markers to predict surgery outcomes. One of the most exciting areas of research in metabolic surgery is the exploration of genetic markers to predict which patients will have the best outcomes from surgical interventions. Currently, While metabolic surgery has been shown to be effective for many patients, the results can vary significantly from person to person. Some patients experience remarkable improvements in their blood sugar control, weight loss, and overall health, while others may not see as dramatic results. Understanding why this happens is a critical step toward improving the precision and success of metabolic surgery. Genetic factors play a significant role in how an individual responds to surgery. A person's genetic makeup can influence everything from their ability to lose weight to how their body processes insulin. By identifying specific genetic markers associated with better outcomes, researchers hope to develop more personalized treatment plans for patients. For example, if a patient's genetic profile indicates that they are likely to respond well to a certain type of surgery, healthcare providers could offer that option with greater confidence. Conversely, if a patient's genetic markers suggest that they might not experience significant benefits from surgery, alternative treatment options could be considered. The potential for genetic testing to predict surgical outcomes is a game-changer in the field of metabolic surgery. It would allow for more targeted and efficient treatments, ensuring that patients receive the best possible care based on their individual genetic predispositions. Furthermore, this research could help identify specific groups of patients who are at a higher risk for complications after surgery, enabling doctors to take preventive measures or offer alternative approaches. The role of precision medicine in metabolic surgery. The concept of precision medicine, which tailors medical treatment to the individual characteristics of each patient, is particularly relevant to the future of metabolic surgery. The integration of genetic markers into the decision-making process would allow for a more nuanced and personalized approach to treatment. For example, some patients may have a genetic predisposition that makes them more susceptible to insulin resistance, while others may have genetic traits that influence how their bodies respond to weight loss. By taking these factors into account, surgeons and endocrinologists can design treatment plans that are more likely to yield positive outcomes. In the future, we may see genetic testing becoming a routine part of the pre-surgical assessment process. Before recommending metabolic surgery, doctors could use genetic tests to evaluate a patient's likelihood of success with the procedure. This would not only improve the success rates of the surgery but also reduce the risk of unnecessary procedures and costs for patients who may not benefit as much from the surgery. Investigating non-surgical interventions mimicking the effects of metabolic surgery. While metabolic surgery has proven to be highly effective, it is not suitable for everyone due to factors such as surgical risks, cost, and patient preferences. As a result, researchers are increasingly investigating non-surgical interventions that can mimic the effects of metabolic surgery, offering similar benefits without the need for an invasive procedure. These non-surgical approaches aim to replicate the improvements in insulin sensitivity, weight loss, and glycemic control that are typically achieved through surgery. One promising area of research involves the use of pharmacological treatments that can replicate the effects of metabolic surgery on the gut hormones involved in glucose metabolism. As previously mentioned, metabolic surgery leads to changes in the production of gut hormones like GLP-1 and GIP, which enhance insulin sensitivity and help regulate blood sugar. Researchers are exploring drugs that can increase the production or effectiveness of these hormones, potentially providing similar benefits to surgery. For example, drugs that mimic the action of GLP-1 are already available and are used to help manage type 2 diabetes. Future medications may take this concept further, offering even more powerful and targeted effects on insulin sensitivity in weight loss. Another area of interest is the use of endoscopic procedures, which are less invasive than traditional surgery. Endoscopy involves the insertion of a thin, flexible tube into the digestive tract to perform procedures without making large incisions. Some endoscopic treatments, such as the use of gastric balloons or the endoscopic sleeve gastroplasty, aim to reduce the size of the stomach and create similar effects to bariatric surgery. While these procedures are still in the early stages of research, they hold great promise for patients who are not candidates for traditional surgery. Researchers are also exploring the role of microbiome manipulation in mimicking the effects of metabolic surgery. The gut microbiome, which consists of trillions of bacteria living in the digestive tract, plays a crucial role in metabolism and the regulation of blood sugar. Studies have shown that patients who undergo bariatric surgery experience changes in their gut microbiome, which may contribute to improvements in weight loss and glycemic control. Scientists are investigating whether altering the microbiome through dietary interventions, probiotics, or other methods could replicate the benefits of metabolic surgery without the need for an invasive procedure. The potential of hormonal treatments and other pharmacological solutions. One of the most exciting avenues of research in non-surgical interventions is the development of hormonal treatments that could simulate the effects of metabolic surgery. After bariatric surgery, there are significant changes in the production of hormones that regulate hunger, metabolism, and insulin sensitivity. For example, after gastric bypass surgery, there is an increase in GLP-1, a hormone that promotes insulin secretion and helps regulate blood sugar. There is also a decrease in ghrelin, a hormone that stimulates hunger. These hormonal changes contribute to the weight loss and improved glycemic control that many patients experience after surgery. Scientists are now investigating ways to harness these hormonal changes without the need for surgery. For instance, medications that mimic the effects of GLP-1 are already being used to treat type 2 diabetes, and new drugs are being developed that could further enhance these effects. Additionally, researchers are looking at other hormones, such as bile acids and fibroblast growth factors, to see if they can be targeted to improve insulin sensitivity and promote weight loss. Hormonal treatments could offer a non-invasive alternative to surgery for patients who are unable or unwilling to undergo metabolic surgery. These treatments could be used in conjunction with lifestyle changes and other interventions to provide a comprehensive approach to managing obesity and type 2 diabetes. In the future, it is possible that hormonal therapies could become a routine part of treatment for these conditions, providing patients with an effective alternative to surgery. Challenges and future directions in research. While the potential for non-surgical interventions and genetic testing is exciting, there are still significant challenges to overcome. For one, the development of effective pharmacological treatments that mimic the effects of metabolic surgery requires a deep understanding of the complex hormonal and metabolic changes that occur after surgery. It will take time and extensive research to identify the most effective compounds and treatment protocols. Similarly, the use of genetic markers to predict surgical outcomes is still in its early stages. While there have been some promising findings, more research is needed to identify the specific genes and pathways involved in the success of metabolic surgery. Additionally, ethical considerations surrounding genetic testing and its integration into clinical practice must be addressed to ensure that this technology is used appropriately and equitably. Another challenge is the accessibility and affordability of these new treatments. While metabolic surgery itself can be expensive, the development of non-surgical alternatives could help reduce costs and make these treatments more widely available. However, ensuring that these treatments are accessible to all patients, regardless of their socioeconomic status, will require careful planning and policy changes. A future of personalized, non-surgical solutions. In conclusion, the future of metabolic surgery and its non-surgical alternatives holds immense promise. As research continues to explore genetic markers and non-surgical interventions that mimic the effects of surgery, patients may have more personalized, effective, and less invasive options to manage obesity and type 2 diabetes. These advancements could revolutionize the way healthcare providers treat these conditions, making treatments more tailored to individual patients and reducing the burden of chronic diseases on healthcare systems worldwide. While challenges remain, the potential for improved outcomes, fewer side effects, and greater accessibility make these research directions incredibly exciting. In the coming years, we may see a shift in how metabolic disorders are treated, with a greater focus on precision medicine, non-invasive therapies, and individualized care plans. The future of metabolic surgery, whether through genetic testing, hormonal treatments, or endoscopic procedures, is a bright one, offering hope for patients who need more effective solutions to manage their health. Metabolic surgery, which has emerged as a groundbreaking treatment option for type 2 diabetes, is reshaping the way this chronic condition is managed. For many patients, it offers significant and long-lasting benefits that go far beyond traditional medical interventions. The impact of metabolic surgery on blood sugar control, weight loss, and overall health can be transformative, with many patients achieving normalized blood sugar levels, enhanced insulin sensitivity, and even remission of diabetes. This shift in treatment has provided new hope for people whose diabetes is poorly controlled with medications or lifestyle changes. However, while metabolic surgery holds enormous potential, it is not a one-size-fits-all solution. The treatment requires careful patient selection, lifelong follow-up care, and an integrated approach involving healthcare providers across various disciplines to ensure that the best possible outcomes are achieved while minimizing risks. The transformative potential of metabolic surgery. Metabolic surgery, particularly bariatric procedures like gastric bypass and sleeve gastrectomy, has proven to be a highly effective way to treat obesity and type 2 diabetes. By altering the anatomy of the gastrointestinal tract, these surgeries induce changes that result in improved metabolic function. For example, patients often experience a rapid improvement in blood sugar levels soon after surgery, sometimes even before significant weight loss occurs. This effect is thought to be due to changes in gut hormones, reduced insulin resistance, and modifications in the gut microbiome, all of which contribute to better glucose regulation. Many patients experience dramatic weight loss, a key factor in managing type 2 diabetes, which directly impacts their long-term health. Beyond simply controlling blood sugar, metabolic surgery has the potential to transform the lives of patients by improving their quality of life. Many patients report better mobility, increased energy levels, and a reduction in the physical limitations that come with obesity and diabetes. It also helps alleviate the comorbidities often associated with type 2 diabetes, such as high blood pressure, high cholesterol, and sleep apnea. For individuals who have struggled with diabetes for years, this surgery can feel like a new lease on life, offering the chance to live without the daily burden of constant blood sugar monitoring and reliance on medications. However, while these outcomes are promising, it's important to remember that the benefits of metabolic surgery are not universal. The effectiveness of the surgery can vary significantly depending on the individual's unique health profile, including their weight, age, medical history, and ability to adhere to post-surgery lifestyle changes. Some patients may experience complications or fail to achieve the desired results, which is why patient selection and thorough pre-surgical assessment are crucial. Careful patient selection, the key to success. Metabolic surgery is not suitable for everyone. In fact, careful patient selection is one of the most important factors in determining whether the surgery will be successful. The decision to proceed with metabolic surgery should be made after a comprehensive evaluation of the patient's health status, including the severity of their diabetes, the presence of obesity, and any other medical conditions they may have. Ideally, metabolic surgery is considered for patients who have obesity, with a body mass index of 35 or higher, and have been unable to achieve sustained weight loss through diet, exercise, and medications. In addition to obesity, candidates for metabolic surgery should have type 2 diabetes that is poorly controlled or difficult to manage with conventional treatments. This includes patients who require high doses of insulin or other medications and still struggle to keep their blood sugar levels within a healthy range. However, there are certain conditions that may disqualify a patient from undergoing metabolic surgery. For example, individuals with certain heart conditions, severe lung disease, or other health problems that increase the risk of surgery may not be suitable candidates. Psychological readiness is also an essential factor to consider, as patients need to commit to lifelong lifestyle changes and follow-up care after surgery. One of the key challenges in patient selection is ensuring that individuals are fully informed about the risks and benefits of the surgery. While the potential benefits are significant, metabolic surgery is still a major medical procedure with associated risks, including infection, bleeding, and nutritional deficiencies. Therefore, it's essential that patients understand what the surgery involves, the recovery process, and the long-term changes they will need to make in their diet, exercise, and overall lifestyle. For some, the idea of permanent changes to their digestive system and the need for lifelong supplementation of vitamins and minerals may be daunting, so psychological support is often necessary to help patients make an informed decision. The need for lifelong follow-up care. One of the most important aspects of metabolic surgery is that it requires lifelong follow-up care to ensure the best possible outcomes and avoid complications. Surgery is just the beginning of a patient's journey. After the procedure, patients must make significant lifestyle changes to maintain their weight loss and manage their blood sugar levels. Regular follow-up appointments with healthcare providers, including surgeons, endocrinologists, nutritionists, and mental health professionals, are essential to ensure that patients are adhering to post-surgery guidelines and are not experiencing any adverse effects. A key aspect of post-surgery care is nutritional management. Since metabolic surgery alters the digestive tract, patients may have difficulty absorbing certain nutrients, leading to deficiencies if they do not take the proper supplements. For example, patients are typically required to take lifelong multivitamins, vitamin B12, calcium, iron, and other essential nutrients to prevent deficiencies. This can be challenging for some patients, as it requires a high level of commitment to lifelong supplementation and careful monitoring of nutrient levels. Failure to comply with these nutritional requirements can lead to serious health issues, including bone loss, anemia, and neurological problems. In addition to nutrition, patients need to adopt healthy eating habits and engage in regular physical activity to support weight loss and prevent weight regain. Post-surgery, patients typically progress through a diet plan that starts with liquids and soft foods and gradually introduces solid foods as the body heals. The goal is to develop healthier eating patterns that focus on nutrient-dense foods while avoiding high-calorie, processed foods. Exercise is equally important, as it helps maintain weight loss and improves overall metabolic health. For many patients, the psychological aspect of maintaining these lifestyle changes is one of the most challenging components of post-surgery care. Coping with changes in eating habits, body image, and lifestyle can be emotionally difficult, and patients may experience feelings of isolation, anxiety, or depression. This is why psychological support is an essential part of the post-surgery care process. Regular counseling or support groups can help patients navigate the emotional challenges they face and provide them with the tools and resources they need to maintain their health and well-being long-term. Integrated care approach for maximum outcomes. The success of metabolic surgery relies not just on the surgery itself but on a coordinated, integrated care approach that involves a team of healthcare professionals working together to support the patient. This team approach is critical in maximizing the benefits of surgery and minimizing the risks. Endocrinologists, surgeons, dietitians, psychologists, and other specialists must collaborate closely to provide comprehensive care that addresses all aspects of the patient's health. For example, endocrinologists play a vital role in managing the patient's diabetes both before and after surgery. They help assess the patient's blood sugar control, adjust medications as needed, and monitor for any changes in insulin sensitivity post-surgery. Surgeons, of course, are responsible for performing the surgery and monitoring the patient's recovery. Dietitians provide guidance on healthy eating, meal planning, and ensuring that patients are meeting their nutritional needs after surgery. Psychologists or counselors are essential in helping patients cope with the emotional and psychological aspects of their weight loss journey, particularly since many individuals who undergo metabolic surgery also have a history of eating disorders or body image issues. In addition to healthcare professionals, family and social support networks are also crucial in helping patients succeed after surgery. Having a strong support system can make a significant difference in a patient's ability to stick to post-surgery lifestyle changes. Encouragement from family and friends can help boost morale, especially during the challenging times when progress may slow down or complications arise. Minimizing risks and ensuring success. While metabolic surgery offers remarkable benefits, it is not without risks. As with any surgical procedure, there are potential complications, including infection, bleeding, and blood clots. In some cases, patients may experience long-term issues such as malnutrition, dehydration, or hypoglycemia. Therefore, it is essential to monitor patients closely after surgery to detect and address any problems early. Regular follow-up visits allow healthcare providers to track progress, adjust treatment plans, and provide necessary interventions. Additionally, some patients may experience weight regain over time, which can lead to a return of their diabetes symptoms. Maintaining weight loss requires ongoing commitment to healthy eating and regular physical activity. When patients regain weight, it can undermine the benefits of the surgery and potentially lead to a recurrence of diabetes or other obesity-related health problems. This highlights the importance of providing ongoing support and counseling to help patients stay on track with their health goals. A comprehensive approach for long-term success. In conclusion, metabolic surgery represents a transformative treatment option for many individuals with type 2 diabetes and obesity. It offers profound improvements in blood sugar control, weight loss, and overall health. However, for these benefits to be sustained over the long term, careful patient selection, lifelong follow-up care, and an integrated approach involving multiple healthcare providers are essential. Patients must be committed to making lifelong changes to their diet, exercise habits, and overall lifestyle, and they must remain vigilant in managing their health to avoid complications. With the right support and ongoing care, metabolic surgery can be a powerful tool in managing type 2 diabetes, improving quality of life, and preventing the long-term complications of obesity and diabetes.